AAPC CPC Certified Professional Coder Exam. Question 1. The documentation states, he was then sterilely prepped and draped along the flank and abdomen in the usual sterile fashion. I first made a skin incision off the tip of the 12th rib, extending medially along the banger's lines of the skin. This was approximately 3.5 centimeters in length. Once this incision was carried sharply, electrocautery was used to gain access through the external oblique, internal oblique, and transverse abdominis musculature and fascia. What surgical approach was used for this procedure? Option A, percutaneous. Option B, laparoscopic. Option C, cannot determine based on the documentation. Option D, open. The correct answer is option D, open. D, open. Question 2. The mediastinum is. Option A, a location in the chest, bounded by the sternum, diaphragm, and lungs. Option B, a small endocrine organ behind the heart. Option C, a part of the lymphatic system. Option D, both the heart and lungs. The correct answer is option A, a location in the chest, bounded by the sternum, diaphragm, and lungs. A, the location in the chest, bounded by the sternum, diaphragm, and lungs. Question 3. Patient is diagnosed with dacryocystitis, which is the inflammation of? Option A, cornea. Option B, fingernail. Option C, eardrum. Option D, lacrimal sac. The correct answer is option D, lacrimal sac. D, lacrimal sac. Question 4. In rhinoplasty. Option A, the nose is reconstructed. Option B, the brow is reconstructed. Option C, the lips are reconstructed. Option D, the chin is reconstructed. The correct answer is option A, the nose is reconstructed. A, the nose is reconstructed. Question 5. Where is a Warthin's tumor found? Option A, ovary. Option B, bone. Option C, salivary gland. Option D, back of eye. The correct answer is option C, salivary gland. C, salivary gland. Question 6. When a patient has ESRD, which system is affected? Option A, cardiovascular. Option B, neurologic. Option C, respiratory. Option D, genitourinary. The correct answer is option D, genitourinary. D, genitourinary. Question 7. The human shoulder is made of which three bones? Option A, olecranon, radius, ulna. Option B, carpal, radius, humerus. Option C, metatarsal, tibia, navicular. Option D, clavicle, scapula, humerus. The correct answer is option D, clavicle, scapula, humerus. D, clavicle, scapula, humerus. Question 8. The outermost protective layer of skin is called the. Option A, epidermis. Option B, hypodermis. Option C, subcutaneous tissue. Option D, dermis. The correct answer is option A, epidermis. A, epidermis. Question 9. The heart chambers are called. Option A, atria and ventricles. Option B, apex and alveoli. Option C, tricuspid and bicuspid. Option D, sphincter and glottis. The correct answer is option A, atria and ventricles. A, atria and ventricles. Question 10. Which bone is located in the lower extremity? Option A, humerus. Option B, femur. Option C, radius. Option D, ulna. The correct answer is option B, femur. B, femur. Question 11. Which one of the following is a commercial or private payer? Option A, Blue Cross Blue Shield. Option B, Medicare. Option C, Medicaid. Option D, Veterans Health Administration, VHA. The correct answer is option A, Blue Cross Blue Shield. A, Blue Cross Blue Shield. Question 12. Which place of service code is submitted on the claim for a service that is performed in an outpatient surgical floor? Option A, 11. Option B, 21. Option C, 22. Option D, 24. The correct answer is option C, 22. C, 22. Question 13. Which entity offers compliance program guidance to form the basis of a voluntary compliance program for a provider practice? Option A, Centers for Medicare and Medicaid Services, CMS. Option B, American Medical Association, AMA. Option C. Office of Inspector General, OIG. Option D. Office for Civil Rights, OCR. The correct answer is option C. Office of Inspector General, OIG. C. Office of Inspector General, OIG. Question 14. A cardiologist attempted to perform a percutaneous transluminal coronary angioplasty of a totally occluded blood vessel. The surgeon stopped the procedure because of an anatomical problem creating risk for the patient and preventing performance of the catheterization. What modifier is appended to the procedure code? Option A, 52. Option B, 53. Option C, 54. Option D, 76. The correct answer is option B, 53. B, 53. Question 15. According to the Repair, Closure, CPT guidelines, what type of repair is reported when a single-layer closure includes copious irrigation and extensive cleaning to remove particulate matter? Option A, simple repair. Option B, complex repair. Option C, intermediate repair. Option D, simple repair plus a code for irrigation. The correct answer is option C, intermediate repair. C, intermediate repair. Question 16. The CPT code book provides full descriptions of medical procedures, although some descriptions require the use of a semicolon, winky face to distinguish among closely related procedures. What is the full description of CPT code 69644? Option A, tympanoplasty with mastoidectomy, including canalplasty. Middle ear surgery, tympanic membrane repair, with intact or reconstructed canal wall, with ossicular chain reconstruction. Option B, without ossicular chain reconstruction with intact or reconstructed canal wall, with ossicular chain reconstruction. Option C, with intact or reconstructed canal wall with ossicular chain reconstruction. Option D, tympanoplasty with mastoidectomy, including canalplasty. Middle ear surgery, tympanic membrane repair, without ossicular chain reconstruction with intact or reconstructed canal wall, with ossicular chain reconstruction. The correct answer is option A, tympanoplasty with mastoidectomy, including canalplasty. Middle ear surgery, tympanic membrane repair, with intact or reconstructed canal wall, with ossicular chain reconstruction. A, tympanoplasty with mastoidectomy, including canalplasty. Middle ear surgery, tympanic membrane repair, with intact or reconstructed canal wall, with ossicular chain reconstruction. Question 17. Which statement regarding lesion excision is true? Option A, lesion excision codes include removal of a lesion, with margins, and simple, non-layered, closure when performed. Option B, lesion excision codes are selected by measuring the greatest clinical diameter of a lesion excluding the margins required to complete the excision. Option C, lesion excision codes include removal of a lesion, with margins, and intermediate closure when performed. Option D, lesion excision codes include removal of a lesion with margins, and complex closure when performed. The correct answer is option A. Lesion excision codes include removal of a lesion, with margins, and simple, non-layered, closure when performed. Reveal solution discussion 1A. Lesion excision codes include removal of a lesion, with margins, and simple, non-layered, closure when performed. Question 18. Which one of the following is an example of a case in which a diabetes-related problem exists and the code for diabetes is never sequenced first? Option A. If the patient has hyperglycemia that is not responding to medication. Option B. If the patient has an underdose of insulin due to an insulin pump malfunction. Option C. If the patient is being treated for secondary diabetes. Option D. If the patient is being treated for type 2 diabetes. The correct answer is option B. If the patient has an underdose of insulin due to an insulin pump malfunction. B. If the patient has an underdose of insulin due to an insulin pump malfunction. Question 19. A patient suffering from idiopathic dystonia is seen today and receives the following botulinum injections: 3 muscle injections in both upper extremities and 7 injections in 6 paraspinal muscles. How are these injections reported according to the CPT guidelines? Option A, 64,644, 64,647 x 7. Option B, 64,642 to 50, 64,643 to 50, 64,647. Option C, 64,642, 64,643, 64,647. Option D, 64,642x3, 64,642x3, 64,647x7. The correct answer is option C, 64,642, 64,643, 64,647. C, 64,642, 64,643, 64,647. Question 20. According to the application of cast and strapping CPT guidelines, what is reported when an orthopedic provider performs initial fracture care treatment for a closed scaphoid fracture of the wrist, applies a short arm cast, and the patient will be returning for subsequent fracture care? Option A, 25,622. Option B, 29,075. Option C, 25,622, 29,075. Option D, 29,075 to 22. The correct answer is option B, 29,075. B, 29,075. Question 21. A patient is diagnosed with diabetic polyneuropathy using ICD-10-CM coding guidelines. What ICD-10-CM coding is reported? Option A, E10.42. Option B, E11.9, G62.9. Option C, E10.9, G62.9. Option D, D11.42. The correct answer is option D, E11.42. D, D11.42. Question 22. An elderly patient comes into the emergency department, ED, with shortness of breath. An ECG is performed. The final diagnosis at discharge is impending myocardial infarction, according to ICD-10-CM guidelines. How is this reported? Option A, I20.0. Option B, R06.02. Option C, I20.0, R06.02. Option D, I21.3, R06.02. The correct answer is option A, I20.0. A, I20.0. Question 23. Patient had polyps removed on a previous colonoscopy. The patient returns 3 months later for a follow-up examination for another colonoscopy. No new polyps are seen. What diagnosis coding is reported for the second colonoscopy? Option A, Z09, Z86.010. Option B, K63.5. Option C, Z86.010, K63.5. Option D, Z09, K63.5. The correct answer is option A, Z09, Z86.010. A, Z09, Z86.010. Question 24. A patient is diagnosed with sepsis and associated acute respiratory failure. What ICD-10-CM code selection is reported? Option A, A41.9, R65.20, J96.00. Option B, A41.9. Option C, A41.9, R65.21, J96.00. Option D, A41.9, J96.00. The correct answer is option D, A41.9, J96.00. D, A41.9, J96.00. Question 25. A 44-year-old female patient with chest pains had a CT of her chest that identified a mass in her left lower lung. The patient currently has ovarian cancer with metastases to the liver. The radiologist suspects the cancer has spread to her lungs. The physician performed an outpatient bronchoscopic biopsy and the pathology report documents the mass as a tumor of uncertain behavior. What ICD-10-CM codes are reported for this patient? Option A, R91.8, C56.9, C78.7. Option B, C56.9, C78.7, C78.02. Option C, C78.02, C22.9, C79.82. Option D, D38.1, C56.9, C78.7. The correct answer is option A, R91.8, C56.9, C78.7. A, R91.8, C 56.9, C 78.7. Question 26. A 35-year-old female has cancer in her left breast. The surgeon performs a mastectomy, removing the breast tissue, skin, pectoral muscles, and surrounding tissue, including the axillary and internal mammary lymph nodes. Which mastectomy code is reported? Option A, 19,303. Option B, 19,305. Option C, 19,306. Option D, 19,307. The correct answer is option C, 19,306. C, 19,306. Question 27. A 30-year-old patient with a scalp defect is having plastic surgery to insert tissue expanders. The provider inserts the implants, closes the skin, and increases the volume of the expanders by injecting saline solution. Tissue is expanded until a satisfactory aesthetic outcome is obtained to repair the scalp defect. What CPT code is reported? Option A, 11,960. Option B, 11,970. Option C, 15,777. Option D, 19,357. The correct answer is option A, 11,960. A, 11,960. Question 28. A 5-year-old is brought to the quick care in the ED to repair 2 lacerations, a 3 cm laceration on her right arm and 2 cm laceration on her nose. Her arm is repaired with a simple 1-layer closure with sutures. Her nose is repaired with a simple repair using tissue adhesive, 2-cyanoacrylate. How are the repairs reported? Option A, 12,013. Option B, 12,032, 12,041 to 59. Option C, 12,002. Option D, 12,002, 12,011 to 59. The correct answer is option C, 12,002. C, 12,002. Question 29. A 25-year-old woman underwent percutaneous breast biopsy on the right breast with placement of a gel mark clip. The procedure was performed using stereotactic imaging. What CPT codes will be reported? Option A, 19,081. Option B, 19,100, 76,098. Option C, 19,101, 19,283. Option D, 19,081, 19,283. The correct answer is option A, 19,081. A, 19,081. Question 30. A patient with 3 thyroid nodules is seen for an FNA biopsy. Using ultrasonic guidance, the provider inserts a 25-gauge needle into each nodule. Nodular tissue is aspirated and sent to pathology. What CPT coding reported? Option A, 10,005, 10,006x2, 76,942. Option B, 10,006x3. Option C, 10,005, 10,006x2. Option D, 10,021, 10,004x2, 76,942. The correct answer is option C, 10,005, 10,006x2. C, 10,005, 10,006x2. Question 31. Mr. Woolridge has had a suspicious lesion on his left shoulder for approximately 8 weeks that is not healing. On the dermatologist's exam of left shoulder blade, there is excoriation and scabbing and the lesion not healing. Patient agrees and wishes to proceed with a punch biopsy of the lesion. A punch biopsy is taken of the lesion and sent to pathology. A simple repair is performed at the biopsy site. What CPT and ICD-10 CM codes are reported? Option A, 11,102, 12,001 to 51, D49.2. Option B, 11,102, L98.9. Option C, 11,104, D49.2. Option D, 11104, 12001-51, L98.9. The correct answer is option C, 11,104, D49.2. C, 11,104, D49.2. Question 32. The surgical preparation of a 25 SQCM wound on the right leg is performed along with a 25 SQCM wound on the left leg. What CPT code is reported? Option A, 15,002. Option B 15,004. Option C 15,004x2. Option D 15,002x2. The correct answer is option C 15,004x2. C 15,004x2. Question 33. What CPT code is reported for an excision of a sacral pressure ulcer with a primary closure? Option A 15,934. Option B 15,931. Option C 15,933. Option D 15,920. The correct answer is option B 15,931. B 15,931. Question 34. A female patient had an FNA biopsy with ultrasound guidance on two separate nodules in the upper outer quadrant of left breast. What CPT and ICD-10 CM codes are reported? Option A 10,005, 10,006, and 63.21. Option B 10,005, 10,006, 76,942, and 60.02. Option C 10,021, 10,004, 76,942, and 60.21. Option D 10,005, 10,005 to 59, and 63.21. The correct answer is option B 10,005, 10,006, 76,942, and 60.02. B 10,005, 10,006, 76,942, and 60.02. Question 35. A 4-year-old has third-degree circumferential burns to his torso. To avoid respiratory compression, an eschorotomy is performed. A total of 4 incisions are made through the eschar down to the subcutaneous fat to release the restrictive effects from the eschar. What CPT coding should you report? Option A 16,035, 16,036 to 51. Option B 16,030. Option C 16,035x4. Option D 16,035, 16,036x3. The correct answer is option D 16,035, 16,036x3. D 16,035, 16,036x3. Question 36. A surgeon performed Mohs micrographic surgery on a lesion on the lower leg. This required one stage with 6 tissue blocks. A direct skin flap was used to cover the defect. What CPT codes are reported for the Mohs surgery and the repair? Option A 17,313, 17,315, 15,572. Option B 17,311, 17,312, 15,570. Option C 17,313, 17,314, 15,572. Option D 17,313, 17,314, 17,315, 15,570. The correct answer is option C 17,313, 17,314, 15,572. C 17,313, 17,314, 15,572. Question 37. Patient presents with a stage 3 pressure ulcer of the sacrum and a stage 3 pressure ulcer of the upper back. Physician performs an 18 SQ.cm debridement of the sacrum down to and including the muscle. During the same session, the physician also performed a 6 SQ.cm debridement of the back down to and including the muscle. How should these services be reported? Option A 11,011, 11,011 to 59. Option B 11,043, 97,597 to 59. Option C 11,043, 11,046. Option D 11,043, 11,043 to 59. The correct answer is option C 11,043, 11,046. C 11,043, 11,046. Question 38. Patient presents with ulcers of the ischium, left heel, and upper back. The physician performs a 12 SQ.cm full thickness debridement of the ischium down to and including the muscle fascia. During the same operative session, the physician also performs a 10 SQ.cm debridement of the upper back down to the muscle. The 4 SQ.cm heel ulcer was debrided down to the bone. How should these services be reported? Option A, 11,043, 11,043 to 59, 11,044 to 59. Option B, 11,043, 11,046, 11,044 to 59. Option C, 11,043, 11,044 to 59. Option D, 11,043, 11,046. The correct answer is option B, 11,043, 11,046, 11,044 to 59. B, 11,043, 11,046, 11,044 to 59. Question 39. The physician excised a 5 mm excised diameter benign blue nevus from the patient's arm and performed a simple closure for a patient for which the physician reported CPT 11,400. A month later, outside the postoperative period, the same patient as in the above question returned to her surgeon's office with a 2 cm malignant lesion on her arm. In order to ensure that the entire malignancy was removed, the surgeon excised the 2 cm lesion and 2 cm skin margin, 1 cm above the lesion and 1 cm below the lesion. This was the narrowest clinical margin required to adequately excise the lesion. How should this be reported? Option A, 11,404. Option B, 11,602. Option C, 11,604. Option D, 11,604 to 58. The correct answer is option C, 11,604. C, 11,604. Question 40. A patient presents for destruction of premalignant lesions. The patient had 5 lesions. What are the correct code S for these services? Option A, 17,000, 17,003 x 4. Option B, 17,000, 17,003. Option C, 11,200. Option D, 17,000 x 5. The correct answer is option A, 17,000, 17,003 x 4. A, 17,000, 17,003 x 4. Question 41. A patient presents for destruction of 3 lesions. The pathologist confirmed that the lesions were dermatofibrosarcomas. Cryosurgery was used to destroy a 1.2 cm back lesion, a 2.1 cm neck lesion, and a 1.2 cm foot lesion. What are the correct code S for these services? Option A, 216.5, 216.4, 216.7, 17,000, 17,003. Option B, 173.59, 173.49, 173.79, 17,273, 17,272 to 59, 17,262 to 59. Option C, 173.59, 173.49, 173.79, 11,602, 11,602 to 59, 11,623 to 59. Option D, 173.89, 17,262 x 3. The correct answer is option B, 173.59, 173.49, 173.79, 17,273, 17,272 to 59, 17,262 to 59. B, 173.59, 173.49, 173.79, 17,273, 17,272 to 59, 17,262 to 59. Question 42. Third-degree burns, 10% TBSA, to the left shoulder and chest. Patient placed in supine position. After general anesthesia, the subcutaneous tissue beneath the full-thickness burn is infiltrated with crystalloid solution containing epinephrine to minimize blood loss. The eschar involving the left shoulder and anterior chest area is excised down to clean bloody bed of viable subcutaneous tissue. A total area of 100 sq/cm is excised and readied for a staged graft procedure to be performed at a later date. Hemostasis is obtained with electrocautery, epinephrine-soaked pads and topical thrombin. Report the physician services. Option A, 942.32, 943.35, 948.11, E924.0, E849.6, E015.2, E000.0, 15,002. Option B, 946.3, 948.11, E924.0, E849.6, E015.2, E000.0, 15,002, 15,220 to 51, 15,221, 15,200 to 51, 15,201 x2. Option C, 948.11, E924.2, E849.6, E015.2, E000.0, 15,002, 15,200 to 51, 15,200 x5. Option D, 942.32, 943.35, 948.10, E924.0, E849.6, E015.2, E000.0, 15,002. The correct answer is option A, 942.32, 943.35, 948.11, E924.0, E849.6, E015.2, E000.0, 15,002. A, 942.32, 943.35, 948.11, E924.0, E849.6, E015.2, E000.0, 15,002. Question 43. A patient presented for a percutaneous needle core biopsy of a lesion in her left breast. The procedure was performed without imaging guidance. What is the correct code for the biopsy procedure? Option A, 19,102. Option B, 11,100. Option C, 19,100. Option D, 19,101. The correct answer is option C, 19,100. C, 19,100. Question 44. A 25-year-old construction worker presents to the emergency department with a penetrating and traumatic open wound to his left arm. He has fallen from a ladder and a small piece of wood has become lodged in his arm. The physician performs an exploration and enlargement of the penetrating wound and removes the foreign body. How should these services be reported? Option A, 959.2, 20,102. Option B, 884.1, 20,103, 24,200 to 51. Option C, 884.1, 20,103. Option D, 959.2, 10,120. The correct answer is option C, 884.1, 20,103. C, 884.1, 20,103. Question 45. A driver suffered a closed Lefort fracture in a motor vehicle accident from striking a guardrail on a highway. The patient now presents for a mid-face reconstruction. The physician uses a Lefort 3 technique involving a complete separation of the midfacial bones. The procedure requires bone grafts, but is performed without Lefort I. How should these services be reported? Option A, 802.4, E815.0, E849.5, 21,155. Option B, 802.4, E815.0, E849.5, 21,154. Option C, 802.4, E816.0, E849.5, 21,141. Option D, 802.5, E829.8, E849.5, 21,150. The correct answer is option B, 802.4, E815.0, E849.5, 21,154. B, 802.4, E8 15.0, E8 49.5, 21,154. Question 46. A physician performs an anterior interbody arthrodesis on C5-C7 including discectomy and decompression of the spinal cord. How should the physician's services be reported? Option A, 22,551, 22,552, 63,075 to 51, 63,076. Option B, 22,551, 22,552, 63,075 to 59, 63,076. Option C, 22,551, 22,552. Option D, 22,554, 22,585, 63,075 to 51, 63,076. The correct answer is option C, 22,551, 22,552. C, 22,551, 22,552. Question 47. Closed fracture of the distal radius of right arm, placed in supine position. After general anesthesia, site is cleaned and prepped. Distal radius is manipulated and fracture fragments are visualized using fluoroscopic imaging. The fracture did not require reduction prior to placing the wires. Small incision was made in optimal site for wire placement. Tissue protector placed over the wire and tissue protector passed through the incision. Wire is drilled into position at the fracture site. After ensuring correct placement, wire is drilled into the second site, completing the fixation process. 2 more wires are placed in similar fashion for stabilization. Report the physician's services. Option A, 813.52, E8 85.1, E006.0, E000.8, 25,606, fluoroscopy included. Option B, 813.42, E8 85.1, E006.0, E000.8, 25,606, 77,002 to 26. Option C, 813.42, E8 85.1, E006.0, E000.8, 25,600, 77,002 to 26. Option D, 813.43, E8 85.1, E006.0, E000.8, 25,574. The correct answer is option B, 813.42, E8 85.1, E006.0, E000.8, 25,606, 77,002 to 26. B, 813.42, E8 85.1, E006.0, E000.8, 25,606, 77,002 to 26. Question 48. In the morning, Dr. Jones attempted to treat a humeral shaft fracture with manipulation. The procedure appeared to be successful. However, later that evening, the patient developed additional problems relating to the fracture. Dr. Williams remanipulated the fracture. The repeat procedure was a success. What modifier should be appended to the code for the procedure performed by Dr. Williams? Option A, -77. Option B, -76. Option C, -62. Option D, -22. The correct answer is option A, -77. A, -77. Question 49. A patient with scoliosis was scheduled for major surgery to repair the shape of his spine. The physician determined that 10 vertebral segments required surgical repair. She performs posterior arthrodesis followed by posterior segmental instrumentation. How should these services be reported? Option A, 737.30, 22,802, 22,843. Option B, 754.2, 22,802, segmental instrumentation is bundled. Option C, 737.30, 22,802, 22,843 to 51. Option D, 754.2, 22,812, 22,847. The correct answer is option A, 737.30, 22,802, 22,843. A. 737.30, 22,802, 22,843. Question 50. A patient presents for an excision of a benign bone tumor of the right clavicle with autograft. How should these services be reported? Option A, 23145 RT. Option B, 23140 RT, 20,936 to 51. Option C, 23150 RT. Option D, 23155 RT. The correct answer is option A, 23145 RT. A, 23145 RT. Question 51. A general surgeon performed a deep biopsy of a soft tissue lesion in the area of the patient's right shoulder. The procedure was not a needle biopsy. While the patient is in the operating room, the surgeon also excised a small 1 cm benign mass from the patient's right hand. How should these services be reported? Option A, 23,066, 11,401 to 59. Option B, 23,066, 11,421 to 59. Option C, 23,076, 11,421 to 59. Option D, 23,076, 11,401 to 59. The correct answer is option B, 23,066, 11,421 to 59. B, 23,066, 11,421 to 59. Question 52. A patient injured his elbow in a motorcycle accident. The physician had to excise the radial head and replace it with an implant. How should these services be reported? Option A, 24,130. Option B, 24,999. Option C, 24,365. Option D, 24,366. The correct answer is option D, 24,366. D, 24,366. Question 53. Dr. Jackson and Dr. Barber, two orthopedic surgeons, performed an anterior interbody arthrodesis of L2 L3. Dr. Barber then proceeded to insert a morcellized allograft and apply anterior instrumentation across L2 L3. How should each physician report their services? Dr. Jackson, Dr. Barber. Option A, Dr. Jackson, 22558-62, 20,930 to 62, 22,845 to 62. Option B, Dr. Jackson, 22558-62, 22,585 to 62. Option C, Dr. Jackson, 22558-62. Option D, Dr. Jackson, 22558-62, 22,585 to 62. The correct answer is option C, Dr. Jackson, 22558-62. Dr. Barber, 20930, 22,845 to 51 C. Dr. Jackson, 22558-62. Dr. Barber, 22558-62, 20,930, 22,845. Question 54. A patient has nasal polyps removed from both sides of her nose. A total of 3 polyps were removed. How should the physician's services be reported? Option A, 30,110 x 3. Option B, 30,115 to 50. Option C, 30,110 x 2. Option D, 30,110 to 50. The correct answer is option D, 30,110 to 50. D, 30,110 to 50. Question 55. Mrs. Johnson underwent outpatient surgery for repair of a fractured left turbinate. The surgeon ended up having to completely remove the left inferior turbinate using a surgical drill to sever it from the lateral nasal wall. The procedure involved only mucosal nasal tissue and did not extend into the submucosal tissue. How should the physician's services be reported? Option A, 30130 LT. Option B, 30140 LT. Option C, 30130-22 LT. Option D, 30140-52 LT. The correct answer is option A, 30130 LT. A. 30130 LT. Question 56. A patient presented to the emergency room with an acute pneumothorax. The ER physician performed a thoracentesis with insertion of a tube under CT guidance. The hospital owned the CT machine. How should the physician report for these surgical services? Option A, 512.0, 32,551, 77,012 to 26. Option B, 512.8, 32,422, 77,012 to 26. Option C, 512.0, 32,422, 75,989 to 26. Option D, 512.8, 32,551, 75,989 to 26. The correct answer is option B, 512.8, 32,422, 77,012 to 26. B. 512.8, 32,422, 77,012 to 26. Question 57. Clara has had trouble breathing for 2 days. Her primary care physician referred her to an ENT. The ENT performed a diagnostic maxillary sinusoscopy. How should the sinusoscopy be reported? Option A, 31,237. Option B, 31,231 to 50. Option C, 31,233. Option D, 31256 RT. The correct answer is option C, 31,233. C, 31,233. Question 58. Beverly had been hoarse for 2 weeks. Her surgeon scheduled a direct laryngoscopy with injection of her vocal cords. During the surgery, it became necessary for the surgeon to use an operating microscope. How should the physician's services be reported? Option A, 31,571. Option B, 31,570, 69,990. Option C, 31,513 to 50. Option D, 31,541 to 50. The correct answer is option A, 31,571. A. 31,571. Question 59. Mr. Baker was talking with his friends when he suddenly collapsed. He was admitted to the hospital and scheduled for replacement of his dual-chamber permanent pacemaker system. The old pulse generator was replaced, and new atrial and ventricular electrodes were placed transvenously. The skin pocket holding the pulse generator also required revision. How should the physician's services be reported? Option A, 33,214, 33,222 to 51. Option B, 33,228, 33,235 to 51, 33,217 to 51, 33,222 to 51. Option C, 33,235, 33,208 to 51, 33,222 to 51, 33,233 to 51. Option D, 33,235, 33,208 to 51, 33,233 to 51. The correct answer is option C, 33,235, 33,208 to 51, 33,222 to 51, 33,233 to 51. C. 33,235, 33,208 to 51, 33,222 to 51, 33,233 to 51. Question 60. A physician replaced a dual-chamber pacing cardioverter defibrillator system. The electrodes were removed and replaced transvenously. How should the physician's services be reported? Option A, 33,223, 33,243 to 51, 33,249 to 51. Option B, 33,241, 33,244 to 51, 33,249 to 51. Option C, 33,244, 33,249 to 51. Option D, 33,218, 33,243 to 51. The correct answer is option B, 33,241, 33,244 to 51, 33,249 to 51. B. 33,241, 33,244 to 51, 33,249 to 51. Question 61. Chronic renal failure seen for VAD placement. Ultrasound used to reveal a patent right subclavian vein. Permanent images recorded. Region is anesthetized and access to right subclavian vein gained under direct ultrasound guidance with 19-gauge needle. Guide wire advanced into venous system. Subcutaneous tunnel anesthetized with lidocaine, epinephrine. Incisions made at the venotomy and chest wall exit site. A 24 cm 14 fr ash split catheter from the chest wall exit site to venotomy site with supplied tunneling device. Serial facial dilation performed with final placement of a 15 fr peel-away sheath into the subclavian vein. Dilator and wire removed followed by placement of the ash split catheter into the venous system. Catheter positioned at cavatorial junction under fluoroscopy. Peel-away sheath removed. Venotomy closed with a single 3.0 vicryl suture followed by dermabond tissue. Report the physician services. Choices. Option A, 585.9, 36,556, 77,000 and 1 to 26, 76,937 to 26. Option B, V56.0, 36,569, 76,937 to 26. Option C, V58.81, 36,558, 77,000 and 1 to 26. Option D, V58.81, 585.9, 36,558, 77,001 to 26 and 76,937 to 26. The correct answer is option Nan. Answer D. V58.81, 585.9, 36,558, 77,001 to 26 and 76,937 to 26. Question 62. Mr. Davis had a single coronary artery bypass graft in 1998 using a venous graft. Unfortunately, the 1998 graft later became occluded and additional blockages developed. Today, the surgeon regrafted the 1998 graft using a venous graft and performed 2 additional grafts, one venous and one arterial. Due to Mr. Davis's peripheral vascular disease, the surgeon had to harvest a radial artery from the patient's left arm for use in doing the arterial graft. The saphenous vein was used for the venous grafts. How should the surgeon's services be reported? Option A, 33,533, 33,530, 35,600, 33,512. Option B, 33,533, 33,530, 35,600 to 51, 33,518 to 51. Option C, 33,533, 33,530, 35,600, 33,518. Option D, 33,533, 33,530, 33,518. The correct answer is option C, 33,533, 33,530, 35,600, 33,518. C, 33,533, 33,530, 35,600, 33,518. Question 63. A patient presents with a previously placed permanent biventricular pacemaker system, both pulse generator and transvenous electrodes, in the right and left ventricles. During this encounter, the physician repositioned the pacemaker electrode in the patient's left ventricle. How should the physician's services be reported? Option A, 33,215. Option B, 33,216. Option C, 33,207 to 76. Option D, 33,226. The correct answer is option D, 33,226. D, 33,226. Question 64. A physician performs a diagnostic colonoscopy through a stoma. During the colonoscopy, the physician removes a foreign body from the colon through the scope. How would these services be reported? Option A, 45,379. Option B, 44,390. Option C, 45,378. 45,378 to 51. Option D, 44,388. 44,390 to 51. The correct answer is option B, 44,390. B, 44,390. Question 65. Two surgeons working together perform a partial esophagectomy with cervical esophagostomy, without reconstruction. How would these services be reported? Option A, 43,124, 43,124 to 51. Option B, 43,124. Option C, 43,124 to 62 for one surgeon, 43,124 to 62 for the second surgeon. Option D, of 43,122 to 62 for one surgeon, 43,122 to 62 for the second surgeon. The correct answer is option C, 43,124 to 62 for one surgeon, 43,124 to 62 for the second surgeon. C, 43,124 to 62 for one surgeon, 43,124 to 62 for the second surgeon. Question 66. A surgeon biopsies 4 lesions during a rigid esophagoscopy. How would these services be reported? Option A, 43,200, 43,202 to 51. Option B, 43,202 x 4. Option C, 43,202. Option D, 43,215. The correct answer is option C, 43,202. C, 43,202. Question 67. The physician removed a foreign body during a flexible esophagoscopy under radiological supervision and interpretation. The same physician provided both the surgical and radiological services. The procedure was performed in a hospital. How would the physician report these services? Option A, 43,200, 74,235 to 26. Option B, 43,215, radiological SNI is bundled. Option C, 43,216. Option D, of 43,215, 74,235 to 26. The correct answer is option D, 43,215, 74,235 to 26. D, 43,215, 74,235 to 26. Question 68. A physician performed an esophagoscopy. Later that same day, the same physician performed a colonoscopy on the same patient. What modifier is used to report the second procedure? Option A, -51. Option B, -57. Option C, -58. Option D, a -59. The correct answer is option D, -59. D, a -59. Question 69. How would a partial colectomy performed in conjunction with a takedown of the splenic flexure be reported? Option A, 44,140. Option B, 44,139. Option C, 44,140, 44,139 to 51. Option D, of 44,140, 44,139. The correct answer is option D, 44,140, 44,139. D, 44,140, 44,139. Question 70. A morbidly obese patient presents to the surgeon for laparoscopic insertion of gastric neurostimulator electrodes into the lesser curvature of the stomach. How would the surgeon report for his services? Option A, 43,881. Option B, 43,647. Option C, 43,659. Option D, of 43,647, 43,659. The correct answer is option C, 43,659. C, 43,659. Question 71. When an appendectomy is performed for an indicated purpose at the time of another major surgery, what additional code is reported for the appendectomy? Option A, 44,950. Option B, this procedure is bundled within the primary procedure. Option C, 44,955. Option D of 44,950 to 52. The correct answer is option C, 44,955. C, 44,955. Question 72. A physician performs a flexible sigmoidoscopy with a biopsy of a lesion. During the same sigmoidoscopy session, the physician removes the same lesion by bipolar cautery. How would these services be reported? Option A, 45,330, 45,333 to 51. Option B, 45,331, 45,333 to 51. Option C, 45,331. Option D, 45,333. The correct answer is option D, 45,333. D, 45,333. Question 73. A general surgeon performs an initial femoral hernia repair on a 37-year-old patient, followed by implantation of mesh. The hernia was incarcerated. How would these services be reported? Option A, 553.00, 49,550. Option B, 553.00, 49,553, 49,568. Option C, 552.00, 49,553, 49,568. Option D, 552.00, 49,553. The correct answer is option D, 552.00, 49,553. D, 552.00, 49,553. Question 74. A patient presents with a renal abscess. The surgeon performs a percutaneous renal abscess drainage. How should these services be reported? Option A, 50,020. Option B, 50,021. Option C, 50,010. Option D, 10,060. The correct answer is option B, 50,021. B, 50,021. Question 75. A single physician changed a patient's nephrostomy tube using radiological guidance. The procedure was performed in the hospital. How should these services be reported? Option A, 75,984. Option B, 50,398, 75,984. Option C, 50,398, the imaging is bundled. Option D, 50,398, 75,984 to 26. The correct answer is option D, 50,398, 75,984 to 26. D, 50,398, 75,984 to 26. Question 76. A surgeon performs a diagnostic laparoscopy followed by a laparoscopic nephrectomy, including partial ureterectomy, during the same surgical session. How should the physician's services be reported? Option A, 50,546. Option B, 49,320, 50,546 to 51. Option C, 49,320. Option D, 50,549. The correct answer is option A, 50,546. A, 50,546. Question 77. A physician performs an aspiration of a patient's bladder. How should the physician's services be reported? Option A, 51,100. Option B, 51,101. Option C, 51,102. Option D, more information is needed. The correct answer is option D, more information is needed. D, more information is needed. Question 78. A patient presents with an abdominal mass and is diagnosed with a bladder tumor. The surgeon performs a cystourethropy with fulguration and resects an 8 cm tumor. During this surgical session, The physician also performs a cystourethropy with the insertion of an indwelling urethral stent. How should these services be reported? Option A, 52,240. The secondary procedure is bundled. Option B, 52,235, 52,282 to 51. Option C, 52,240, 52,283 to 51. Option D, 52,240, 52,282 to 51. The correct answer is option D, 52,240, 52,282 to 51. D, 52,240, 52,282 to 51. Question 79. A physician performs a simple cystourethropy with the removal of a self-retaining indwelling ureteral stent. This procedure is performed within the global period of a previous surgery. The stent had been inserted during the previous surgery. How should these services be reported? Option A, 52,310 to 78. Option B, 52,315 to 58. Option C. The stent removal is included into the post-op care and may not be reported separately. Option D, 52,310 to 58. The correct answer is option D, 52,310 to 58. D, 52,310 to 58. Question 80. A patient requires a vasovasostomy. The surgeon operates on the patient while utilizing an operating microscope. How should these services be reported? Option A, 55,300, 69,990 to 51. Option B, 55,400. Option C, 55,400, 69,990 to 51. Option D, 55,400, 69,990. The correct answer is option D, 55,400, 69,990. D, 55,400, 69,990. Question 81. PSA 6.8 recently underwent transrectal ultrasound and biopsy of prostate. Positive for adenocarcinoma. Patient opted for intensity-modulated radiation therapy. Today is placement of fiducial markers for radiation therapy guidance. Patient positioned on left side. Digital rectal exam is performed and anus is dilated. Transrectal ultrasound probe inserted into rectum and prostate is visualized in transverse and sagittal planes. Local anesthetic at the base, apex of prostate gland, and perineum. Utilizing ultrasonic needle guidance, for preloaded gold fiducial markers are introduced and implanted bilaterally at base and apex of prostate. Positions of seeds confirmed, transrectal probe removed and transrectal pressure applied. Report for the physician's professional services. Do not report for the supply item of the fiducial markers. Option A, 55,875, 76,965 to 26. Option B, 55,876, 77,002 to 26. Option C, 55,876, 76,942 to 26. Option D, 77,418 to 26, 76,942 to 26. The correct answer is option C, 55,876, 76,942 to 26. C, 55,876, 76,942 to 26. Question 82. A gynecologist performs a loop electrode conization and an endocervical curettage of the cervix via colposcopy, including upper/adjacent vagina, during the same surgical session. How should these services be reported? Option A, 57,461, 57,456 to 51. Option B, 57,461, 57,505 to 51. Option C, 57,522, 57,505 to 51. Option D, 57,461. The correct answer is option D, 57,461. D, 57,461. Question 83. A gynecologist performs a radical vulvectomy on a patient. The physician removes 60% of the vulvar area. How should these services be reported? Option A, 56,620. Option B, 56,625. Option C, 56,630. Option D, 56,633. The correct answer is option C, 56,630. C, 56,630. Question 84. Rita, a patient of Dr. Smith, is pregnant for the second time. Rita delivered her first baby via cesarean. Dr. Smith informed her that there was a very good chance for a successful vaginal delivery this time. However, the patient elected to deliver her second baby via cesarean. Dr. Smith provided all normal antepartum and postpartum care. How should these services be reported? Option A, 59,510. Option B, 59,514. Option C, 59,899. Option D, 59,620. The correct answer is option A, 59,510. A, 59,510. Question 85. A patient presents with a large mass on the left side of the neck. The patient is diagnosed with a thyroid goiter. The surgeon performs a left total thyroid lobectomy. How should the surgeon's professional services be reported? Option A, 60240 LT. Option B, 60220 LT. Option C, 60,220. Option D, 60,240. The correct answer is option B, 60220 LT. B, 60220 LT. Question 86. Using an intradural approach, a physician excised an intradural lesion at the base of the anterior cranial fossa. How should the physician's services be reported? Option A, 61,583, 61,601. Option B, 61,583, 61,601 to 51. Option C, 61,581, 61,608 to 51. Option D, 61,583, 61,601 to 59. The correct answer is option B, 61,583, 61,601 to 51. B, 61,583, 61,601 to 51. Question 87. A physician percutaneously placed a spinal neurostimulator electrode catheter array into the epidural area of the lumbar spine and subcutaneously placed a spinal neurostimulator receiver with inductive coupling. How should the physician's services be reported? Option A, 63,650, 63,685 to 51. Option B, 63,650, 63,685. Option C, 63,655, 63,650 to 51, 63,685 to 51. Option D, 63,655, 63,685 to 59. The correct answer is option A, 63,650, 63,685 to 51. A, 63,650, 63,685 to 51. Question 88. A patient who suffers from osteoarthritis of L3-4 and L4-5 is scheduled for paravertebral facet joint injections of Solacortef and Marcaine 2%. A facet joint is injected at L3-L4 and another injection is performed at L4-L5. The physician utilizes fluoroscopic guidance for accurate needle placement. The services were performed in the hospital outpatient department. How would you report for the physician's professional service? Option A, 721.42, 64,483 and 64,484. Option B, 721.3, 64,493, 64,494. Option C, 721.3, 64,493, 64,494, 77,003 to 26. Option D, 721.90, 64,490, 64,491. The correct answer is option B, 721.3, 64,493, 64,494. B, 721.3, 64,493, 64,494. Question 89. A physician performs an enucleation of Mrs. Miller's right eye with placement of an implant. The muscles were attached to the implant during the same operative session. Also during the same operative session, the physician performed a surgical repair of the conjunctiva with conjunctival graft. How should the physician's services be reported? Option A, 65103 RT, 68320-51 RT. Option B, 65105 RT. Option C, 65105 RT, 68320-51 RT. Option D, 68320 RT. The correct answer is option C, 65105 RT, 68320-51 RT. C, 65105 RT, 68320-51 RT. Question 90. Mr. Roberts was hit in the eye by a staple from an electric staple gun. A piece of the staple lodged in the posterior segment of the eye. The piece of the staple was removed with a magnet via an anterior route. How should the physician's services be reported? Option A, 65265 RT. Option B, 65,920. Option C, 65,260. Option D, 67120 RT. The correct answer is option C, 65,260. C, 65,260. Question 91. A physician performed a mechanical vitrectomy using a pars plana approach with removal of preretinal cellular membrane via ophthalmic endoscope. During the same operative session, the physician removed a splinter from the posterior segment using non-magnetic extraction. How should the physician's services be reported? Option A, 67,041, 66,990 to 51, 65,265 to 51. Option B, 67,036, 67,041 to 51, 65,260 to 51. Option C, 67,041, 65,265 to 51. Option D, 67,041, 66,990, 65,265 to 51. The correct answer is option D, 67,041, 66,990, 65,265 to 51. D, 67,041, 66,990, 65,265 to 51. Question 92. A physician performed a complex extracapsular cataract extraction with simultaneous insertions of intraocular lens. The patient was diagnosed with cataracts due to type I diabetes mellitus. How should the physician's services be reported? Option A, 250.51, 366.41, 66,982. Option B, 366.41, 250.41, 66,984. Option C, 250.51, 366.41, 66,984. Option D, 366.9, 250.01, 66,982. The correct answer is option A, 250.51, 366.41, 66,982. A, 250.51, 366.41, 66,982. Question 93. A physician corrected a problem with misalignment of the eye by performing strabismus surgery on a patient's lateral rectus, medial rectus, and superior oblique eye muscles. Both horizontal muscles were transposed during the procedure. How should the physician's services be reported? Option A, 67,312, 67,314 to 51, 67,320. Option B, 67,312, 67,318 to 51, 67,320. Option C, 67,312, 67,314 to 51. Option D, 67,312, 67,318 to 51. The correct answer is option B, 67,312, 67,318 to 51, 67,320. B, 67,312, 67,318 to 51, 67,320. Question 94. A physician performed a radical tympanoplasty with mastoidectomy and reconstruction of the ossicular chain. An oval window fistula was repaired during the same operative session. How should the physician's services be reported? Option A, 69,641, 69,667 to 51. Option B, 69,636, 69,666 to 59. Option C, 69,646, 69,666 to 51. Option D, 69,633, 69,667 to 59. The correct answer is option C, 69,646, 69,666 to 51. C, 69,646, 69,666 to 51. Question 95. Patient presented to the ED for treatment of trauma to the left kidney. ED physician got history and examined the patient. ED physician called in a urologist to consult on the case. Neither the urologist nor any other member of the group has seen the patient before. Urologist got comprehensive history and performed a comprehensive exam. During the course of this workup, the urologist decided to schedule the patient for outpatient surgery the next day. The urologist then properly documented the consult, including the request for the consult, and communicated her opinion back the ED physician in writing. The consultant's report was filed in the patient's medical record. The patient was then released home to return the next day for the outpatient surgical procedure. How should the urologist's E&M services be reported? Option A, 99,205 to 57. Option B, 99,245 to 57. Option C, 99,245 to 25. Option D, 99,285 to 57. The correct answer is option B, 99,245 to 57. B, 99,245 to 57. Question 96. Dr. Lin, a rheumatologist, had been treating Betty for severe rheumatoid arthritis for years. Betty was recently in a bad car accident and was admitted into the hospital by Dr. Marty, an orthopedic surgeon, for treatment of a distal supracondylar fracture of the right femur. Dr. Marty asked Dr. Lin to manage Betty's rheumatoid arthritis while she was in the hospital. However, he did not request a consult. Dr. Lin saw Betty in the hospital. She took a detailed history and performed a detailed exam. Medical decision-making of moderate complexity, including reviewing recent lab test results regarding Betty's qualitative rheumatoid factor. How should Dr. Lin's inpatient encounter with Betty be reported? Option A, 821.23, 99,253. Option B, 821.23, 99,221. Option C, 714.0, 99,233. Option D, 714.0, 99,233, 86,430. The correct answer is option C, 714.0, 99,233. C, 714.0, 99,233. Question 97. An ED physician provided 2.5 hours of uninterrupted critical care services in the ED for a critically ill 35-year-old established patient. A comprehensive exam was performed as a part of the critical care services. Medical decision-making was of high complexity. Option A, 99,285. Option B, 99,291, 99,292 x 3. Option C, 99,285 to 25, 99,291, 99,292 x 3. Option D, 99,285 to 22. The correct answer is option B, 99,291, 99,292 x 3. B. 99,291, 99,292 x 3. Question 98. Ms. Jones was seen by her primary care physician for her annual checkup 1 year ago. She now presents to the same physician on her 40th birthday for another annual checkup. The physician performed a comprehensive preventive medicine reevaluation including an age and gender-appropriate history and exam. The physician discovered that Ms. Jones had an arrhythmia. After completing the preventive medicine service, the physician decided to take additional history and perform an additional examination to determine whether Ms. Jones was developing atrial fibrillation. The additional history consisted of a brief history of present illness and a problem-pertinent system review. The additional exam consisted of a complete examination of the cardiovascular system. How should this encounter be reported? Option A, 99,396, 99,214 to 25. Option B, 99,396. Option C, 99,214. Option D, 99,396, 99,213 to 25. The correct answer is option A, 99,396, 99,214 to 25. A, 99,396, 99,214 to 25. Question 99. George suffers from chronic hypertension. He has been a patient of Dr. Callahan's for 15 years. George last saw Dr. Callahan regarding his hypertension 3 days ago where he provided E&M services. During that encounter Dr. Callahan changed George's antihypertensive medication from Lopressor to Cozar. Today, George calls Dr. Callahan to discuss the fact that his new medication makes him extremely dizzy. The call lasted 14 minutes. Dr. Callahan arranges to see George the following day in the office to address his adverse effects of the Cozar. How should Dr. Callahan's services for today be reported? Option A, 99,442. Option B, 98,967. Option C, 99,441. Option D, not reported separately. The correct answer is option D, not reported separately. D, not reported separately. Question 100. Mr. Davis was awakened at 2 a.m. by crushing chest pain. He called his primary care physician, Dr. Henry, who asked him to go to the hospital emergency department immediately and wait for him. Both Mr. Davis and Dr. Henry arrived at the ED at the same time. Dr. Henry took a comprehensive history and performed a comprehensive exam. Medical decision-making was of high complexity. Dr. Henry then admitted Mr. Davis with a diagnosis of an acute myocardial infarction. No ED physician was involved in the case. Because of the comprehensive nature of the services provided in the emergency department, no additional history, exam or medical decision-making was necessary to complete the admission. What E&M code, S, would be used to report Dr. Henry's services? Option A, 99,285. Option B, 99,285, 99,223 to 25. Option C, 99,223. Option D, 99,223, 99,285 to 25. The correct answer is option C, 99,223. C, 99,223. Question 101. Mr. George gets regular allergy injections, however, he had not seen his allergist, Dr. Green, for almost a year. He presented today to Dr. Green's office complaining of mild asthma. Dr. Green took a comprehensive history and performed a detailed exam. Medical decision-making was of moderate complexity. While Mr. George was in the office, Dr. Green gave Mr. George his regular weekly allergy shot. How should the physician services provided during this encounter be reported? Option A, 95,115, 99,203 to 25. Option B, 95,115, 99,214 to 25. Option C, 99,214, 95,115 to 25. Option D, 99,214. The correct answer is option B, 95,115, 99,214 to 25. B. 95,115, 99,214 to 25. Question 102. Dr. Jane saw Ralph, a 30-year-old HIV patient, in the office for treatment of thrush relating to his HIV disease. Dr. Jane had not seen Ralph for over 6 months. Dr. Jane performed a comprehensive history and a comprehensive exam. Medical decision-making was of moderate complexity. The total encounter lasted 90 minutes. Of the 90 minutes, 50 minutes were spent counseling Ralph on various aspects of managing his disease and coordinating Ralph's care. Ralph was present in the office with Dr. Jane for the entire 90 minutes. How should Dr. Jane report this encounter? Option A. 042, 112.0, 99,215, 99,354. Option B. 112.0, V08, 99,214. Option C. 112.0, V08, 99,214, 99,354. Option D. 042, 112.0, 99,215, 99,354 to 25. The correct answer is option A. 042, 112.0, 99,215, 99,354. A. 042, 112.0, 99,215, 99,354. Question 103. Mr. Johnson is in the intensive care unit of the hospital. Mr. Johnson sustained a massive hemorrhage in his brain 2 weeks ago. Mr. Johnson is no longer considered critically ill but remains in the intensive care unit. The attending physician, Dr. Sampson, sees Mr. Johnson today. He performs a problem-focused history, a detailed exam and medical decision-making of moderate complexity. The total encounter time was 40 minutes. How should Dr. Sampson report this encounter? Option A. 99,232. Option B. 99,291. Option C. 99,251. Option D. 99,252. The correct answer is option A. 99,232. A. 99,232. Question 104. An otherwise healthy 10-month-old infant is administered a general anesthetic by an anesthesiologist for a lower abdominal hernia repair. The infant was born full term. The anesthesiologist was not involved in any other cases. What code S should be used to report the anesthesia services? Option A. 00836 AAP1. Option B. 00834 AAP1. Option C. 00834 AAP1, 99,100. Option D. 49,495 to 47. The correct answer is option B. 00834 AAP1. B. 00834 AAP1. Question 105. A 76-year-old male with mild hypertension presents to the hospital for a scheduled surgical bronchoscopy with bronchial alveolar lavage. Moderate sedation is administered by the surgeon who completes the procedure. The procedure inter-service time is 30 minutes. What code S should be used to report the anesthesia services? Option A. 00520 AAP2, 99,100. Option B. 31,624, 99,100, 99,144. Option C. 31624P2, 99,144. Option D. 31,624. The correct answer is option D. 31,624. D. 31,624. Question 106. In a rural area, an otherwise healthy female patient presents to the local 25-bed hospital with extreme upper abdominal pain. It is 2:30 in the morning and the surgeon on call decides that she needs an emergency splenectomy. There is no anesthesiologist present. The surgeon decides that there is no time to waste and he performs a total splenectomy using an open technique. He personally administered general anesthesia. How should this encounter be reported? Option A. 00790 AAP1, 99,140. Option B. 38,100 to 47, 99,140. Option C. 38,100 to 47. Option D, 38,100 to 47, 00790 AAP1, 99,140. The correct answer is option C, 38,100 to 47. C, 38,100 to 47. Question 107. Ms. Jones, an otherwise healthy 29-year-old, arrives at the hospital in an ambulance because she has unexpectedly gone into labor. The CRNA quickly administers an epidural under the direction of an anesthesiologist. Although Ms. Jones had planned to deliver vaginally, after several hours of continued labor and minor complications, it becomes apparent that vaginal delivery was too risky. The obstetrician performs a cesarean delivery. The CRNA also provided the anesthesia for the cesarean delivery. What code S should be used to report the CRNA's anesthesia services? Option A, 01967QXP1, 01968QXP1. Option B, 01967QXP1. Option C, 01961QXP1. Option D, 01968QXP1. The correct answer is option A, 01967QXP1, 01968QXP1. A, 01967QXP1, 01968QXP1. Question 108. Dr. Roberts, a vascular surgeon, administers a digital block to anesthetize a healthy 41-year-old patient's finger prior to performing surgery to repair a damaged blood vessel in the finger. What code should be used to report the anesthesia services? Option A, 01850 AAP1. Option B, 35,207 to 23. Option C, 35,207 to 47. Option D, none. The anesthesia services are not separately reported. The correct answer is option D, none. The anesthesia services are not separately reported. D, none. The anesthesia services are not separately reported. Question 109. A surgeon administers general anesthesia on a 70-year-old male prior to performing an emergency partial hepatectomy to control hemorrhage. How should the surgeon's services be reported? Option A, 47120-47AA. Option B, 47,120 to 47. Option C, 47,120, 00792 AAP1, 99,100, 99,140. Option D of 47,120, 99,100, 99,140. The correct answer is option B, 47,120 to 47. B, 47,120 to 47. Question 110. An anesthesiologist personally performs monitored anesthesia care for a 73-year-old patient with type 2 diabetes. The surgeon performs a complex craniectomy for evacuation of a deep subdural hematoma. How should the anesthesiologist's services be reported? Option A, 00210 AAP2. Option B, 00211 AAQSP2. Option C, 00210 AAP2, 99,100. Option D, 00211 AAG8P2, 99,100. The correct answer is option D, 00211 AAG8P2, 99,100. D, 00211 AAG8P2, 99,100. Question 111. Mr. Bear is a 72-year-old champion golfer. Other than mild hypertension, which he has had for years, he enjoys good health. However, his cardiologist recently determined that he had some blockage in one of his coronary arteries. The blockage was successfully treated by an interventional radiologist who performed percutaneous transluminal coronary balloon angioplasty of the artery. Dr. Su, an anesthesiologist, administered general anesthesia for the procedure while medically directing 2 other procedures. How should Dr. Su's services be reported? Option A, 01925 ADP2. Option B, 01925 AD. Option C, 01925 QKP2, 99,100. Option D, 01925 QKP2, 99,100 to 51. The correct answer is option C, 01925 QKP2, 99,100. C, 01925 QKP2, 99,100. Question 112. A physician interpreted a CT study of cervical spine, C2-C4 area, with 4 contrast. How should the physician's professional services be reported? Option A, 70,491 to 26. Option B, 70,492 to 26. Option C, 72,126 to 26. Option D, 72,126 to 26. 62,284. The correct answer is option C, 72,126 to 26. C, 72,126 to 26. Question 113. A physician interpreted a CT of the abdomen and pelvis with contrast. The films were taken by the physician's staff in his office using X-ray equipment owned by the practice. How should these radiology services be reported? Option A, 74,177 to 26. Option B, 74,160, 72,193, 74,177. Option C, 74,177 x 2. Option D, 74,177. The correct answer is option D, 74,177. D, 74,177. Question 114. A 27-year-old female was seen by her OB/GYN for an annual checkup. Although the patient had never experienced any problems with her breasts, as a part of the checkup, her OB/GYN referred her to a local freestanding, i.e., not hospital-affiliated, women's imaging center for her biannual mammogram. 2 views were taken of each breast. After the patient left, the radiologist on duty at the imaging center interpreted the films. The images were then digitized and analyzed by computer. The physician then interpreted the digitized images and computerized analysis. The radiologist found a small mass in the left breast and reported her findings back to the OB/GYN the next day. The imaging center bills globally. How should the services provided by the imaging center be reported? Option A, 77,057, 77,052. Option B, 77,057 to 26. Option C, 77,055, 77,052. Option D, 77,055 to 26, 77,057 to 26. The correct answer is option A, 77,057, 77,052. A, 77,057, 77,052. Question 115. An interventional radiologist performed an arteriogram via the common femoral artery. The physician guided the catheter into the arch of the aorta. Contrast was injected and images were interpreted. The radiologist then manipulated the catheter through the left subclavian artery, first order, thoracic branch, and into the left vertebral artery, second order, thoracic branch in the same family as the subclavian artery, where contrast was injected. Images of the left vertebral artery in the neck were obtained and interpreted. How should this interventional radiology session be reported? Option A, 36,245, 36246 LT, 75,650 to 26, 75,685 to 26. Option B, 36,200, 36215 LT, 36216 LT, 75,650 to 26, 75,685 to 26. Option C, 36,215, 36216 LT, 75,685 to 26. Option D, 36,216, 75,650 to 26, 75,685 to 26. The correct answer is option D, 36,216, 75,650 to 26, 75,685 to 26. D, 36,216, 75,650 to 26, 75,685 to 26. Question 116. A physician performed a percutaneous needle core biopsy of a breast lesion using mammographic guidance to place the needle. How should the physician's professional services be reported? Option A, 19,100, 77,032 to 26. Option B, 19,102, 77,032 to 26. Option C, 19,102, 76,942 to 26. Option D, 19,102, 77,031 to 26. The correct answer is option B, 19,102, 77,032 to 26. B, 19,102, 77,032 to 26. Question 117. How would a radiation oncologist report the professional services required to develop a clinical treatment plan involving 3 converging ports, 2 treatment areas and multiple blocks? Option A, 77,285. Option B, 77,407. Option C, 77,262. Option D, 77,263. The correct answer is option C, 77,262. C, 77,262. Question 118. A hospital inpatient underwent 5 different radiation therapy sessions. Each session involved a single treatment area and parallel opposed ports. A total of 5 MeV of energy was delivered during each of the treatment sessions. How should the hospital report the delivery of this radiation treatment? Option A, 77,402 x 5. Option B, 77,427. Option C, 77,407. Option D, 77,406. The correct answer is option A, 77,402 x 5. A, 77,402 x 5. Question 119. A patient underwent a complete course of radiation therapy involving a total of 7 fractions, i.e., treatment sessions, over a 2-week period. Each fraction involved multiple treatment areas. A total of 10 MeV of energy was delivered during each of the treatment sessions. How should the radiation oncologist report the radiation treatment management services he provided in connection with this course of therapy? Option A, 77,427 x 7. Option B, 77,427. Option C, 77,427, 77,431. Option D, 77,413 x 7. The correct answer is option B, 77,427. B, 77,427. Question 120. Mr. Mays was treated for prostate cancer 5 years ago. Mr. Mays is now presenting to the hospital for a PET, positron emission tomography, scan for tumor imaging of his head for detection of brain metastases. The physician concurrently performs a CT of the head without contrast to localize the anatomic location to be studied. During the same encounter, the same physician also performs a CT of the chest without contrast to determine the cause of Mr. Mays' severe chest pain he has been experiencing over the past few months. How should the physician's professional services be reported? Option A, 78,814 to 26, 70450-26-59, 71250-26-59. Option B, 78,815 to 26. Option C, 78,814 to 26, 71250-26-59. Option D, 78,814, 71,250 to 59. The correct answer is option C, 78,814 to 26, 71250-26-59. C, 78,814 to 26, 71250-26-59. Question 121. A physician ordered an electrolyte panel from a local laboratory company. The order form supplied by this company indicates the following tests are always included whenever an electrolyte panel is ordered: carbon dioxide, chloride, glucose, potassium, and sodium. The lab company performed all of these tests. How should the lab company report these services? Option A, 82,374, 82,435, 84,132, 84,295, 82,947. Option B, 80,051, 82,374, 82,435, 84,132, 84,295, 82,947. Option C, 80,051. Option D, 80,051, 82,947. The correct answer is option D, 80,051, 82,947. D, 80,051, 82,947. Question 122. Multiple drug class chromatographic drug testing was performed to determine whether a patient had amphetamines and opiates in his system. A single stationary phase was run to test for both drug classes. However, two separate mobile phases were required to complete the testing. How should these lab services be reported? Option A, 80,100x2. Option B, 80,101x2. Option C, 80,100, 80,101. Option D, 80,100. The correct answer is option A, 80,100x2. A, 80,100x2. Question 123. A lab performed a calcitonin stimulation panel consisting of 3 separate calcitonin tests. How should these lab services be reported? Option A, 80,410, 82,308x3. Option B, 82,308x3. Option C, 80,410. Option D, 82,308, 82,308 to 91x3. The correct answer is option C, 80,410. C, 80,410. Question 124. A pathologist was asked to consult on the results of a quantitative urine alkaloid test taken in a primary care physician's office. The pathologist reviewed the test results but did not review the patient's records or personally examine the patient. A written report was produced by the pathologist rendering his opinion and sent back to the primary care physician's office. How should the pathologist's services be reported? Option A. The pathologist's professional services should not be separately reported, they are a part of the lab's overhead. Option B, 80,500. Option C, 82,101, 80,500. Option D, 82,101. The correct answer is option B, 80,500. B, 80,500. Question 125. A 6-year-old child was taken to the hospital emergency department after swallowing a lead toy soldier. A lead toxicity test was performed immediately and the patient was started on 4 infusion of a detoxification agent. 3 hours later, a lead test was run again to determine whether the 4 infusion was reducing the level of lead in the patient's blood. How should these lab services performed in connection with this encounter be reported? Option A, 83,655. Option B, 83,655x2. Option C, 83,655 to 91. Option D, 83,655, 83,655 to 91. The correct answer is option D, 83,655, 83,655 to 91. D, 83,655, 83,655 to 91. Question 126. A physician aspirated a sample of bone marrow and then interpreted a smear from the sample. How should the physician's professional services be reported? Option A, 38,220, 85,097. Option B, 38,220, 88,305 to 26. Option C, 38,221, 85,097. Option D, 85,097. The correct answer is option A, 38,220, 85,097. A, 38,220, 85,097. Question 127. A quantitative colony count bacterial culture of the urine was performed with isolation and presumptive identification of isolates. How should these lab services be reported? Option A, 87,040. Option B, 87,070. Option C, 87,075. Option D, 87,088. The correct answer is option D, 87,088. D. 87,088. Question 128. Cytopathology slides prepared from a vaginal specimen were manually screened with computer-assisted rescreening using cell selection with the Bethesda system of reporting. This service was performed by lab personnel under physician supervision. The initial results were positive. The pathologist then reviewed the initial test results and rendered an interpretation. How should these lab services, including the physician interpretation, be reported? Option A, 88,154. Option B, 88,167, 88,141. Option C, 88,154, 88,141. Option D, 88,142, 88,141. The correct answer is option B, 88,167, 88,141. B, 88,167, 88,141. Question 129. A patient who had developed a tumor on his tonsils underwent surgery for resection of the tonsils. After the tonsils had been removed and the patient was sent to the recovery room, the tonsils were sent, as a single specimen, to the pathologist for gross and microscopic evaluation. How should the pathologist's services be reported? Option A, 88,305 to 26. Option B, 88,304 to 26. Option C, 88,309 to 26. Option D, 88,399 to 26. The correct answer is option C, 88,309 to 26. C, 88,309 to 26. Question 130. A patient presented for a colonoscopy. The gastroenterologist biopsied 3 polyps from the colon and sent each polyp as a separately identified specimen to pathology requesting a pathology consult while the patient was still on the table. Tissue blocks and frozen sections were then prepared and examined as follows. Specimen 1, first tissue block 3 frozen sections, second tissue block 1 frozen section. Specimen 2, first tissue block 2 frozen sections, second tissue block 4 frozen sections. Specimen 3, single tissue block 3 frozen sections. How should the pathologist's services be reported? Option A, 88,331 to 26, 88,332 to 26x5. Option B, 88,331 to 26x3, 88,332 to 26x10. Option C, 88,331 to 26x8, 88,332 to 26x5. Option D, 88,331 to 26x3, 88,332 to 26x2. The correct answer is option D, 88,331 to 26x3, 88,332 to 26x2. D, 88,331 to 26x3, 88,332 to 26x2. Question 131. A primary care physician administers DTP, live mumps and live measles vaccines at the same office visit. All 3 vaccines were administered from separate vials. The DTP was administered by intramuscular injection. The mumps and measles were administered by separate subcutaneous injections. How should these injections be reported? Option A, 96,372, 96,374, 96,375, 90,701, 90,704, 90,705. Option B, 90,471, 90,472 x2, 90,701, 90,707. Option C, 90,471, 90,472 x2, 90,701, 90,704, 90,705. Option D, 90,471, 90,472, 90,700, 90,704, 90,705. The correct answer is option C, 90,471, 90,472 x2, 90,701, 90,704, 90,705. C. 90,471, 90,472 x 2, 90,701, 90,704, 90,705. Question 132. A primary care physician administered 100 mg of RSV immune globulin by intramuscular injection. How should these services be reported? Option A, 96,372, 90,378 x 2. Option B, 96,372, 90,378. Option C, 96,372 x 2, 90,378 x 2. Option D, 99,211 to 25, 90,378 x 2. The correct answer is option A, 96,372, 90,378 x 2. A, 96,372, 90,378 x 2. Question 133. A psychiatrist saw his patient at a residential care facility. The psychiatrist provided 50 minutes of face-to-face individual psychotherapy relating to the patient's schizophrenia. The purpose of the treatment was to attempt to help the patient modify his behavior to better manage his disease. How should the physician's services be reported? Option A, 90,826. Option B, 90,806. Option C, 90,818. Option D, 90,819. The correct answer is option C, 90,818. C. 90,818. Question 134. An ophthalmologist performed an intermediate medical examination and evaluation on an established patient. He determined that the patient needed contact lenses. The ophthalmologist prescribed and fitted one pair of contact lenses. The supply of the contact lenses was considered included in the fitting service. This patient does not have aphakia. How should these services, including the supply of the contact lens, be reported? Option A, 92,002, 92,314 to 51. Option B, 92,012, 92,310 to 51. Option C, 92,012, 92,314 to 51. Option D, 92,002, 92,310 to 51. The correct answer is option B, 92,012, 92,310 to 51. B. 92,012, 92,310 to 51. Question 135. Dr. Fredericks performed a cardiac catheterization on Mrs. Dillon last week to determine the extent of her coronary artery disease. She was subsequently admitted to the hospital for surgery. The surgeon performed a PTCA on the left anterior descending coronary artery and placed a stent in the left circumflex coronary artery. All of these services were performed during the same operative session. How should this surgical session be reported? Option A, 92,980, 92,982 to 51. Option B, 92,982, 92,984. Option C, 92,980, 92,984. Option D, 92,980. The correct answer is option C, 92,980, 92,984. C. 92,980, 92,984. Question 136. Mr. Tyler was admitted to the hospital and had a combined right and left heart catheterization. The operative session included injection procedures for a left ventriculography and aortography. Imaging supervision, interpretation, and generation of a report were also performed. A single physician provided all of these services. How should the physician's professional services be reported? Option A, 93,460 to 26, 93,567, 93,563. Option B, 93,453 to 26, 93,567. Option C, 93,451 to 26, 93,542 to 26, 93,567 to 51. Option D, 93,453 to 26, 93,567 to 51. The correct answer is option B, 93,453 to 26, 93,567. B. 93,453 to 26, 93,567. Question 137. Dr. May and Dr. Lin teamed up to perform a real-time image with two-dimensional M-mode recording for a transesophageal echocardiography study for Mr. Thompson, an 81-year-old male with a history of coronary artery disease. Dr. May placed the transesophageal probe and Dr. Lin acquired the images and produced a written interpretation. How should these physician services be reported? Option A, Dr. Lin, 93312-26. Option B, Dr. Lin, 93314-62. Option C, Dr. Lin, 93317-26. Option D, Dr. Lin, 93314-26. The correct answer is option D, Dr. Lin, 93314-26. Dr. May, 93313D, Dr. Lin, 93314-26, Dr. May, 93313. Question 138. Judy went to see her allergist for follow-up allergy testing. She was last seen by the same physician 1 month ago. Because Judy had recently recovered from the flu, the allergist took a brief interval history, 5 minutes, prior to administering the tests. She then administered 3 intradermal tests with allergenic extracts, delayed type reaction, and interpreted the test results. How should these services be reported? Option A, 95,028 x 3, 99,211 to 25. Option B, 95,024 x 3, 99,211 to 25. Option C, 95,028 x 3. Option D, 95,028, 99,211 to 25. The correct answer is option A, 95,028 x 3, 99,211 to 25. A, 95,028 x 3, 99,211 to 25. Question 139. A physical therapist placed a hot pack on Jane's right shoulder and left the hot pack in place for 15 minutes while he attended to other patients. When the therapist returned, he provided 15 minutes of ultrasound treatment on Jane's same shoulder. The therapist then provided 15 minutes of therapeutic exercise to the same shoulder. How should the physical therapist services be reported? Option A, 97,035 to 51, 97,110. Option B, 97,010, 97,035, 97,110. Option C, 97,010, 97,028, 97,110. Option D, 97,010, 97,035 to 51, 97,110 to 51. The correct answer is option B, 97,010, 97,035, 97,110. B, 97,010, 97,035, 97,110. Question 140. Mr. West is recovering at home from a postoperative wound infection. A home health nurse administered 4 cephalosporin, an antibiotic supplied by the patient. This 4 administration and home health visit lasted 4 hours. How should these services be reported? Option A, 96,374, 99,601 to 51, 99,602. Option B, 99,601, 99,243 to 25. Option C, 99,601, 99,602 x 2. Option D, 99,243, 96,374 to 51. The correct answer is option C, 99,601, 99,602 x 2. C, 99,601, 99,602 x 2. Question 141. Which term identifies the imaginary line that separates the body into upper and lower halves? Option A, coronal. Option B, transverse. Option C, sagittal. Option D, dorsal. The correct answer is option B, transverse. B, transverse. Question 142. Molluscum contagiosum is a condition best described as A. Option A. A malignant skin lesion caused by a virus. Option B. A benign skin lesion. Option C. A benign skin lesion caused by a virus. Option D. A skin lesion. The correct answer is option C. A benign skin lesion caused by a virus. C. A benign skin lesion caused by a virus. Question 143. Which of the following is not a term that is typically used to describe a type of fracture? Option A. Comminuted. Option B. Linear. Option C. Percutaneous. Option D. Green stick. The correct answer is option C. Percutaneous. C. Percutaneous. Question 144. Formation of new red blood cells takes place in the Option A. Liver. Option B. Bone marrow. Option C. Spleen. Option D. Lymph nodes. The correct answer is option B. Bone marrow. B. Bone marrow. Question 145. The ilium is Option A. A bone that is part of the pelvic girdle. Option B. The small intestine. Option C. The large intestine. Option D. A portion of the iliac artery. The correct answer is option A. A bone that is part of the pelvic girdle. A. A bone that is part of the pelvic girdle. Question 146. A tenotomy is Option A. A procedure involving an incision into the eardrum. Option B. A procedure involving an incision into the tenomatic membrane. Option C. A procedure involving the surgical cutting of a tendon. Option D. A procedure involving the complete removal of one or more tendons. The correct answer is option C. A procedure involving the surgical cutting of a tendon. C. A procedure involving the surgical cutting of a tendon. Question 147. According to CPT, which pair of organs are considered part of two separate body systems? Option A. Thyroid and thymus. Option B. Bovary and testes. Option C. Gallbladder and jejunum. Option D. Epiglottis and larynx. The correct answer is option B. Ovary and testes. B. Ovary and testes. Question 148. Which of following statements best describes the function of the arteries? Option A. They carry oxygen-loaded blood from the heart to other parts of the body. Option B. They return blood to the heart from throughout the body. Option C. They carry blood from the heart to other parts of the body. Option D. They are used to reroute blockages in and around the heart and coronary vessels. The correct answer is option C. They carry blood from the heart to other parts of the body. C. They carry blood from the heart to other parts of the body. This question probably cannot be answered from the coding manuals. However, this is an important concept that students should commit to memory. Many students incorrectly answer A for this question. While the usual function of the arteries is to carry oxygen-loaded blood from the heart to other parts of the body, there is one circumstance, the pulmonary arteries, in which arteries actually carry oxygen-depleted blood. The pulmonary arteries carry oxygen-depleted blood from the heart to the lungs, where the carbon dioxide in the blood is exchanged for oxygen. The oxygen-loaded blood is then returned to the heart through the pulmonary veins. Question 149. A xenograft is a graft. Option A. From another species. Option B. From the same body. Option C. From another human being. Option D. From a cadaver. The correct answer is option A. From another species. A. From another species. Question 150. Which of the following terms is used to describe a vertebral segment? Option A. A single complete vertebral bone only. Option B. The non-bony compartment between two adjacent vertebral bodies and the associated articular processes and laminae. Option C. The non-bony compartment between two adjacent vertebral bodies. Option D. A single complete vertebral bone with its associated articular processes and laminae. The correct answer is option D. A single complete vertebral bone with its associated articular processes and laminae. D. A single complete vertebral bone with its associated articular processes and laminae. Question 151. The term adenosine refers to Option A. A sine wave examination of the adenoids. Option B. A diagnostic study of the adenoids. Option C. A drug. Option D. A device used to treat the adenoids. The correct answer is option C. A drug. C. A drug. Question 152. The vestibule of the mouth includes Option A. Lips, tongue, cheek. Option B. Tongue, cheek. Option C. Mucosal and submucosal tissue of lips and cheeks. Option D. Lips, cheeks, pharynx. The correct answer is option C. Mucosal and submucosal tissue of lips and cheeks. C. Mucosal and submucosal tissue of lips and cheeks. Question 153. TURP is an acronym for Option A. Transurethral renal pyelotomy. Option B. Transurethral resection of prostate. Option C. Transurethral renal pelvectomy. Option D. Transurethral repair of prostate. The correct answer is option B. Transurethral resection of prostate. B. Transurethral resection of prostate. Question 154. The suffix oriphy means Option A. Resection. Option B. Suture/surgical repair. Option C. Grafting. Option D. Reimplantation. The correct answer is option B. Suture/surgical repair. B. Suture/surgical repair. Question 155. Cryotherapy involves the use of Option A. Heat treatment. Option B. Artificial tears. Option C. A freezing probe. Option D. A laser treatment. The correct answer is option C. A freezing probe. C. A freezing probe. Question 156. Trichiasis is Option A. Fungal infection of eyelashes. Option B. Trichomonal infection of eyelashes. Option C. A lice infestation of eyelashes. Option D. Ingrown or misdirected eyelashes. The correct answer is option D. Ingrown or misdirected eyelashes. D. Ingrown or misdirected eyelashes. Question 157. Which of the following conditions would be considered to be volvulus? Option A. Infection of one of the cardiac valves. Option B. Obstruction of the intestine due to an overgrowth of valvular tissue. Option C. An inflammation of the external genital organs of a female. Option D. Strangulation of the intestine. The correct answer is option D. Strangulation of the intestine. D. Strangulation of the intestine. Question 158. Dysphagia is Option A. Abnormal cell growth. Option B. Speech disturbance. Option C. Difficulty swallowing. Option D. Shortness of breath. The correct answer is option C. Difficulty swallowing. C. Difficulty swallowing. Question 159. Which of the following lists only components of the digestive system? Option A. Mouth, large intestine, liver, spleen. Option B. Trachea, stomach, large intestine, anus. Option C. Mouth, stomach, pancreas, colon. Option D. Stomach, liver, colon, spleen. The correct answer is option C. Mouth, stomach, pancreas, colon. C. Mouth, stomach, pancreas, colon. Question 160. Which of the following is not part of the endocrine system? Option A. Pituitary. Option B. Pancreas. Option C. Ovaries. Option D. Lymph nodes. The correct answer is option D. Lymph nodes. D. Lymph nodes. Question 161. What does the term acromegaly mean? Option A. Fear of heights. Option B. Enlarged kidneys. Option C. Enlarged extremities. Option D. Fear of falling. The correct answer is option C. Enlarged extremities. C. Enlarged extremities. Question 162. What is another term for the bicuspid valve in the heart? Option A. Mitral valve. Option B. Tricuspid valve. Option C. Pulmonary valve. Option D. Aortic valve. The correct answer is option A. Mitral valve. A. Mitral valve. Question 163. Which of the following types of diagnosis codes should never be reported as the first listed diagnosis code? Option A. V codes. Option B. Codes printed in italics in the tabular list. Option C. Poisoning codes. Option D. Codes for signs or symptoms. The correct answer is option B. Codes printed in italics in the tabular list. B. Codes printed in italics in the tabular list. Question 164. Jimmy fell off his bicycle, leisure, and was taken to a local hospital's emergency department. The emergency physician did an expanded problem-focused history, an expanded problem-focused exam and performed medical decision-making of moderate complexity. The exam reveals a 3 cm laceration to Jimmy's forehead and a large contusion to his right knee. The knee X-rays were negative. The physician did a simple repair of the laceration. Select the appropriate diagnosis codes for this encounter. Option A, 873.42, 924.11, E826.1, E006.4, E000.8. Option B, 873.42, 924.11, E885.2, E006.4, E000.8. Option C, 873.52, 924.11. Option D, 873.42, 924.10, E826.1, E006.4, E000.8. The correct answer is option A, 873.42, 924.11, E826.1, E006.4, E000.8. A, 873.42, 924.11, E826.1, E006.4, E000.8. Question 165. Susie presented to the emergency department vomiting blood. The emergency physician determined that the vomiting was due to esophageal varices resulting from liver cirrhosis. Select the appropriate diagnosis codes for this encounter. Option A, 456.0, 571.5. Option B, 456.20, 571.5. Option C, 571.2, 456.21. Option D, 571.5, 456.20. The correct answer is option D, 571.5, 456.20. D, 571.5, 456.20. Question 166. Mr. Morgan reports to his physician feeling very dizzy. It is discovered that his blood pressure is elevated, 210/190. The physician documents a diagnosis of end-stage renal failure due to malignant hypertension. Select the appropriate diagnosis code, S, for this encounter. Option A, 403.01. Option B, 403.01, 585.9. Option C, 403.01, 585.6. Option D, 404.02, 585.6. The correct answer is option C, 403.01, 585.6. C, 403.01, 585.6. Question 167. Mr. Barber reported to his primary care physician complaining of difficulty breathing. He is HIV positive, but prior to today has never had any symptoms of HIV disease. The physician examined Mr. Barber and documented that his breathing difficulty was due to pneumocystis carinii pneumonia, PCP, a HIV-related disease. Select the appropriate diagnosis code, S, for this encounter. Option A, 136.3, V08. Option B, 042, 136.3. Option C, 042, 480.8, 079.89. Option D, 136.3, 042. The correct answer is option B, 042, 136.3. B, 042, 136.3. Question 168. Mr. Sawyer was adding water to his car battery when the battery exploded. He reported to the local burn center that tracks the mortality of burns. After examining Mr. Sawyer, the emergency physician documented a diagnosis of third-degree burns to the right palm and a second-degree burn to his left cheek and forehead. The physician determined that the burns were caused by contact with the battery acid. Total body surface burned was documented as less than 10%. Select the appropriate diagnosis codes for this encounter. Option A, 944.35, 941.20, 948.00, E924.1. Option B, 944.30, 941.24, 948.00, E923.2. Option C, 944.35, 941.27, 948.10, E924.1. Option D, 944.35, 941.27, 948.00, E924.1. The correct answer is option D, 944.35, 941.27, 948.00, E924.1. D, 944.35, 941.27, 948.00, E924.1. Question 169. Carrie reported to her physician with an acute sore throat. The physician diagnosed this as strep throat and gave her prescription for ampicillin. After taking 2 doses as prescribed, Carrie developed a skin rash. She returned to the physician, who determined that she was experiencing dermatitis as a reaction to the ampicillin. The physician discontinued the ampicillin and called in a prescription for another antibiotic. Select the correct diagnosis codes for this encounter. Option A, 960.0, 693.0, E930.0, 034.0. Option B, 693.0, E856, 034.0. Option C, 693.0, E930.0, 034.0. Option D, 692.3, E930.0, 034.0. The correct answer is option C, 693.0, E930.0, 034.0. C, 693.0, E930.0, 034.0. Question 170. Russell has been a type I insulin-dependent diabetic for 20 years without any complications. 2 days ago he began to experience episodes of blurred vision. During one of these episodes, Russell stubbed his left big toe. Today it is extremely inflamed, painful, and has a small ulceration. He saw his primary care physician, who determined that Russell had a diabetic ulcer of the left big toe. Select the correct diagnosis codes for this encounter. Option A, 250.83, 707.10, V58.67. Option B, 250.81, 707.15. Option C, 250.81, 707.19. Option D, 250.83, 707.15, V58.67. The correct answer is option B, 250.81, 707.15. B, 250.81, 707.15. Question 171. Vanessa saw her primary care physician 3 days ago. At that time, the physician diagnosed a urinary tract infection and prescribed an antibiotic. Today, the culture and sensitivity from the earlier encounter was returned from the lab. Based on the lab report, the physician concluded that the UTI was due to E. coli. The physician decided to change Vanessa's antibiotic. After speaking with Vanessa on the phone, the physician called in a prescription for a new antibiotic. Select the correct diagnosis code, S, for the original encounter, assuming that the physician reviewed the culture and sensitivity and documented her findings prior to billing for the encounter. Option A, 041.49, 599.0. Option B, 599.0. Option C, 599.0, 041.49. Option D, 041.49, 599.89. The correct answer is option C, 599.0, 041.49. C, 599.0, 041.49. Question 172. Mrs. Ashworth is 2 months post-partial mastectomy for breast cancer. She is still undergoing radiation therapy for the breast cancer. During the hospitalization for her mastectomy, she was found to have another primary malignancy in her kidney. She presents to her oncologist today for further workup relating to the kidney cancer. While she is in the office, the physician also examines her breast and determines that, unfortunately, the cancer is still present in the upper outer portion of her left breast. Select the correct diagnosis codes for today's encounter. Option A 174.4, 189.0. Option B 189.0, V10.3. Option C 189.0, 174.4. Option D 198.0, 174.4. The correct answer is option C, 189.0, 174.4. C 189.0, 174.4. Question 173. Mrs. Ashworth is 5 months pregnant and presents to her OB/GYN for management of her gestational diabetes during the antepartum period. Select the correct diagnosis codes for today's encounter. Option A 648.03, 250.00. Option B 648.01. Option C 250.00, V22.2. Option D 648.83. The correct answer is option D, 648.83. D 648.83. Question 174. What HCPCS Level II supply code would be reported for a 2 mg oral administration of tacrolimus? Option A, J7525. Option B, J7507X2. Option C, J7599. Option D, J7507. The correct answer is option B, J7507X2. B, J7507X2. Question 175. Jennifer is diabetic and must check her blood sugar regularly. Her primary care physician supplied 2 boxes of lancets to her for use in checking her blood sugar. Each box contained 100 lancets. What HCPCS Level II code would be reported for the supply of these lancets? Option A, A4259. Option B, A4258. Option C, A4259X2. Option D, A4258X2. The correct answer is option C, A4259X2. C, A4259X2. Question 176. Mr. Thomas, a 72-year-old, goes to his primary care physician for a yearly physical. While there it is determined that Mr. Thomas should undergo a screening flexible sigmoidoscopy for colorectal cancer. What HCPCS Level II code would be used to report this encounter? Option A, G0105. Option B, G0104. Option C, G0106. Option D, G0121. The correct answer is option B, G0104. B, G0104. Question 177. A physician administers 12 cubic centimeters of IM gamma globulin immunization in his office. What HCPCS Level II supply code, S, would be used in reporting this drug? Option A, J1550, J1470. Option B, J1460X12. Option C, J1560. Option D, J1510X2. The correct answer is option C, J1560. C, J1560. Question 178. Mr. Stewart was in a car accident and had to have both legs amputated. The local DME company supplied him an amputee wheelchair with fixed full-length arms and swing-away, detachable footrests. What HCPCS Level II code would be reported for supplying this wheelchair? Option A, E1180. Option B, D1130. Option C, D1200. Option D, D1140. The correct answer is option C, E1200. C, E1200. Question 179. Which of the following is a key difference between add-on codes and modifier -51 exempt codes? Option A. The modifier -51 exempt codes are never reported with a modifier. Option B. The add-on codes may be reported in addition to other codes for services provided during the same encounter. Option C. Add-on codes are never reported as standalone codes. Option D. An add-on code is never reported if the service provided is a component of a more comprehensive service provided during the same encounter. The correct answer is option C. Add-on codes are never reported as standalone codes. C. Add-on codes are never reported as standalone codes. Question 180. The phrase separate procedure, when listed in parentheses at the end of a CPT code description, means that option A. The code should always be reported separately whenever the service described by the code is performed. Option B. The code should not be reported separately if the service described by the code was a component of a more comprehensive service provided during the same encounter. Option C. The code should only be reported if the service described by the code was the only service provided during the encounter. Option D. The code should only be reported when a separate physician performed the service described by the code. The correct answer is option B. The code should not be reported separately if the service described by the code was a component of a more comprehensive service provided during the same encounter. B. The code should not be reported separately if the service described by the code was a component of a more comprehensive service provided during the same encounter. Question 181. Which of the following is not an acceptable method of reporting the CPT code? S. For surgical services, when no single code accurately and fully describes the services performed during a particular outpatient surgical session. Option A. Report the code that most closely reflects the physician work involved even if the code does not exactly describe the specific services performed. Option B. Report a combination of codes that, taken together, accurately and fully describe the services performed. Option C. Report the code that most closely describes the services performed, modified by either a -22 or a -52 modifier as appropriate to reflect the differences between the description for the code and the actual services performed. Option D. Report the unlisted code that best describes the services performed. The correct answer is option A. Report the code that most closely reflects the physician work involved even if the code does not exactly describe the specific services performed. A. Report the code that most closely reflects the physician work involved even if the code does not exactly describe the specific services performed. Question 182. Which of the following is not considered a part of the CPT surgical package? Option A. All E&M encounters on the day prior to the surgery and the day of the surgery. Option B. Local anesthesia. Option C. Evaluation of the patient in the recovery area. Option D. Typical uncomplicated follow-up care. The correct answer is option A. All E&M encounters on the day prior to the surgery and the day of the surgery. A. Call E&M encounters on the day prior to the surgery and the day of the surgery. Question 183. What does the acronym CPT stand for? Option A. Current physician treatment. Option B. Classified patient terms. Option C. Clinical procedural tactics. Option D. Current procedural terminology. The correct answer is option D. Current procedural terminology. D. Current procedural terminology. Question 184. What does it mean when a procedure is assigned a category I code from the CPT manual? Option A. AMA endorses the procedure. Option B. The procedure is covered by all insurance companies. Option C. CMS recognizes these experimental procedures as covered procedures. Option D. The procedure is consistent with contemporary medical practice and is performed by many practitioners in clinical practice in multiple locations. The correct answer is option D. The procedure is consistent with contemporary medical practice and is performed by many practitioners in clinical practice in multiple locations. D. The procedure is consistent with contemporary medical practice and is performed by many practitioners in clinical practice in multiple locations. Question 185. What does the acronym AMA stand for? Option A. American Medical Authority. Option B. The Association of Medical Assistants. Option C. American Medical Association. Option D. American Medical Applicants. The correct answer is option C. American Medical Association. C. American Medical Association. Question 186. What organization, S, are responsible for the development and update of the CPT code set? Option A. Centers for Disease Control, CDC, oversee the code assignment and identifies which procedures will receive a CPT code. The CDC then relays this information to the CPT editorial panel of the AMA. Option B. American Medical Association. Option C. American Medical Association, AMA, and Center for Medicare and Medicaid Services, CMS, together develop and update CPT codes. Option D. Medical specialty societies identify what procedures need codes and American Medical Association, AMA, assigns the codes based on the medical society's decision. The correct answer is option B. American Medical Association. B. American Medical Association. Question 187. Who can use the CPT codes to report their services? Option A. Physicians only. Option B. Physicians and their office staff. Option C. Physicians and outpatient facilities. Option D. Physicians, other qualified healthcare professionals and outpatient facilities. The correct answer is option D. Physicians, other qualified healthcare professionals and outpatient facilities. D. Physicians, other qualified healthcare professionals and outpatient facilities. Question 188. What option, if any, does a physician practice have when a claim has been denied by Medicare? Option A. Identify the reason for the denial and follow the appeals process set forth by Medicare when applicable. Option B. Identify the reason for the denial and then change the codes to bypass the denial. Option C. Resubmit with different dates of service and always append modifier 59 to denied codes. Option D. There is no appeal process, so the practice can choose to write off the service or bill the patient directly for the unpaid services. The correct answer is option A. Identify the reason for the denial and follow the appeals process set forth by Medicare when applicable. A. Identify the reason for the denial and follow the appeals process set forth by Medicare when applicable. Question 189. During a regular checkup, Dr. Stevens discovered a suspicious lesion on the floor of Paul's mouth and decided to perform an excision. Which CPT code covers the excision of an oral lesion? Option A. 40,800. Option B. 41,105. Option C. 41,113. Option D. 40,804. The correct answer is option C. 41,113. C. 41,113. Question 190. While shaving, Robert accidentally caused a small cut on his chin that later became infected. He visited a healthcare provider who incised and drained the infected area. Which CPT code covers the incision and drainage of an infected cut? Option A. 10,080. Option B. 10,021. Option C. 10,060. Option D. 10,160. The correct answer is option C. 10,060. C. 10,060. Question 191. Lucas, a professional swimmer, developed a cyst in his arm due to repetitive motion. The doctor decided to excise the cyst. Which CPT code represents the excision of a cyst? Option A. 20,005. Option B. 20,055. Option C. 20,010. Option D. 20,020. The correct answer is option D. 20,020. D. 20,020. Question 192. Ella's doctor suspected she might have diabetes. He ordered a hemoglobin A1C test to assess her average blood sugar levels over the past 3 months. Which CPT code represents the hemoglobin A1C test? Option A. 83,036. Option B. 83,033. Option C. 83,035. Option D. 83,034. The correct answer is option A. 83,036. A. 83,036. Question 193. Riley had an overactive thyroid and was recommended for a thyroid lobectomy. Which CPT code pertains to this procedure? Option A. 60,210. Option B. 60,212. Option C. 60,220. Option D. 60,225. The correct answer is option C. 60,220. C. 60,220. Question 194. After a series of tests, Dr. Wright determined that Katie had a kidney stone and recommended a percutaneous nephrostolithotomy. Which CPT code corresponds to this procedure? Option A. 50,010. Option B. 50,020. Option C. 50,200. Option D. 50,543. The correct answer is option D. 50,543. D. 50,543. Question 195. Ethan, experiencing persistent flank pain, underwent a diagnostic renal angiography. Which CPT code represents this procedure? Option A, 50,010. Option B, 50,220. Option C, 50,200. Option D, 50,398. The correct answer is option A, 50,010. A, 50,010. Question 196. The relative value unit RVU associated with a CPT code reflects. Option A, the complexity of the procedure. Option B, the average time a procedure takes. Option C, the cost associated with performing the procedure. Option D, all of the above. The correct answer is option D, all of the above. D, all of the above. Question 197. What does the term bradycardia refer to? Option A, fast heartbeat. Option B, slow heartbeat. Option C, irregular heartbeat. Option D, strong heartbeat. The correct answer is option B, slow heartbeat. B, slow heartbeat. Question 198. After weeks of sinus congestion, Olivia saw an ENT specialist. The doctor decided to perform a nasal endoscopy. Which CPT code describes this procedure? Option A, 30,000. Option B, 30,140. Option C, 31,231. Option D, 31,237. The correct answer is option C, 31,231. C, 31,231. Question 199. During her yoga class, Claire felt a sharp pain in her thigh. The doctor diagnosed her with a seroma that needed drainage. Which CPT code should be used for the drainage of a seroma? Option A, 20,005. Option B, 20,055. Option C, 20,010. Option D, 20,016. The correct answer is option C, 20,010. C, 20,010. Question 200. Jackson has been feeling pain and pressure in his sinuses. The ENT decided to perform a sinusotomy to improve drainage. Which CPT code represents this procedure? Option A, 31,020. Option B, 31,256. Option C, 31,287. Option D, 31,288. The correct answer is option B, 31,256. B, 31,256. Question 201. During a routine checkup, Mark was diagnosed with essential, primary, hypertension. Which ICD-10-CM code represents this condition? Option A, I-10. Option B, I-11.9. Option C, I-12.9. Option D, I-13.10. The correct answer is option A, I-10. A, I-10. Question 202. After tests indicated abnormal parathyroid function, Natalie underwent a parathyroidectomy. Which CPT code represents this procedure? Option A, 60,212. Option B, 60,240. Option C, 60,100. Option D, 60,500. The correct answer is option D, 60,500. D, 60,500. Question 203. David uses a manual wheelchair due to his mobility limitations. Which HCPCS Level II code pertains to a standard manual wheelchair? Option A, K0001. Option B, K0002. Option C, K0003. Option D, K0004. The correct answer is option A, K0001. A, K0001. Question 204. After a fall, Clara's primary care doctor ordered an X-ray of her wrist. The radiologist took 3 views of her wrist. Which CPT code pertains to this X-ray? Option A, 73,110. Option B, 73,100. Option C, 73,120. Option D, 73,115. The correct answer is option A, 73,110. A, 73,110. Question 205. While eating popcorn, Mike felt a sharp pain and found he had bitten the inside of his cheek, causing a mucocele. His dentist performed a removal of the mucocele. Which CPT code pertains to this procedure? Option A, 40,804. Option B, 40,812. Option C, 41,108. Option D, 40,819. The correct answer is option A, 40,804. A, 40,804. Question 206. During a routine checkup, Brian was diagnosed with benign essential hypertension. What ICD-10-CM code should be used for this diagnosis? Option A, I-10. Option B, by 15.0. Option C, by 15.1. Option D, by 15.2. The correct answer is option A, I-10. A, I-10. Question 207. Megan had been facing difficulty urinating. Her urologist performed a cystourethropy to diagnose the issue. Which CPT code describes this procedure? Option A, 52,000. Option B, 50,250. Option C, 50,200. Option D, 50,395. The correct answer is option A, 52,000. A, 52,000. Question 208. Ryan has had chronic sinusitis for months. The doctor advised functional endoscopic sinus surgery to clear the blockages. Which CPT code should be used for this procedure? Option A, 31,255. Option B, 31,256. Option C, 31,267. Option D, 31,276. The correct answer is option B, 31,256. B, 31,256. Question 209. Which part of the brain is responsible for regulating vital functions like heartbeat and breathing? Option A, cerebellum. Option B, medulla oblongata. Option C, cerebrum. Option D, pons. The correct answer is option B, medulla oblongata. B, medulla oblongata. Question 210. After a trip to a tropical country, Jessica was diagnosed with dengue fever without warning signs. Which ICD-10-CM code represents this diagnosis? Option A, A90. Option B, A91. Option C, A92.0. Option D, A92.8. The correct answer is option A, A90. A, A90. Question 211. After a car accident, Liam required a retrograde pyelography to assess kidney damage. Which CPT code should be used for this procedure? Option A, 50,320. Option B, 50,430. Option C, 50,200. Option D, 50,390. The correct answer is option B, 50,430. B, 50,430. Question 212. Olivia went to the pediatrician for her annual checkup. The doctor conducted a comprehensive review covering her past, family, and social history. Which CPT code represents this level of history taking? Option A, 99,391. Option B, 99,382. Option C, 99,392. Option D, 99,381. The correct answer is option D, 99,381. D, 99,381. Question 213. During his physical therapy, John was provided with a therapeutic elastic band. Which HCPCS Level II code represents the supply of this band? Option A, A4450. Option B, A4465. Option C, A4466. Option D, A4470. The correct answer is option B, A4465. B, A4465. Question 214. Dr. Lewis suspected a liver issue with Lily and ordered a comprehensive metabolic panel. Which CPT code is for a comprehensive metabolic panel? Option A, 80,053. Option B, 80,051. Option C, 80,050. Option D, 80,055. The correct answer is option A, 80,053. A, 80,053. Question 215. The heart is enclosed in a double-layered sac called the Option A, pericardium. Option B, myocardium. Option C, endocardium. Option D, epicardium. The correct answer is option A, pericardium. A, pericardium. Question 216. Osteoporosis describes a condition where option A, bones become soft and bendable. Option B, bone density is increased. Option C, bones are broken easily. Option D, bones become brittle and fragile due to loss of tissue. The correct answer is option D, bones become brittle and fragile due to loss of tissue. D, bones become brittle and fragile due to loss of tissue. Question 217. Leo had been experiencing difficulty breathing and went to a clinic. The doctor performed a procedure to remove nasal polyps. Which CPT code corresponds to this procedure? Option A, 30,110. Option B, 30,140. Option C, 30,220. Option D, 31,237. The correct answer is option A, 30,110. A, 30,110. Question 218. For his severe back pain, Dr. Simmons administers an epidural injection to Mike. Which HCPCS Level II code corresponds to the supply of the injection? Option A, J1020. Option B, J1030. Option C, J1040. Option D, J1050. The correct answer is option C, J1040. C, J1040. Question 219. Experiencing persistent headaches, Daniel was sent for an MRI of his brain. Which CPT code covers an MRI of the brain without contrast? Option A, 70,551. Option B, 70,553. Option C, 70,549. Option D, 70,550. The correct answer is option A, 70,551. A, 70,551. Question 220. Dr. Johnson saw Sarah in the ER after she experienced a severe asthma attack. After stabilization, he conducted a comprehensive review of her systems and medical history. Which CPT code represents this level of history taking? Option A, 99,221. Option B, 99,218. Option C, 99,223. Option D, 99,220. The correct answer is option C, 99,223. C, 99,223. Question 221. Ella went to the doctor after experiencing pain from a swollen salivary gland. The doctor performed a coelolithotomy. Which CPT code represents this procedure? Option A, 40,810. Option B, 40,812. Option C, 40,819. Option D, 40,820. The correct answer is option D, 40,820. D, 40,820. Question 222. During a follow-up visit, Dr. Allen asked Emily about the progress of her symptoms, her current medications, and performed a limited examination. Which CPT code represents this level of service? Option A, 99,212. Option B, 99,214. Option C, 99,213. Option D, 99,215. The correct answer is option C, 99,213. C, 99,213. Question 223. In medical terminology, the prefix osteo- relates to which of the following? Option A, bone. Option B, heart. Option C, liver. Option D, brain. The correct answer is option A, bone. A, bone. Question 224. Lucas went to the hospital after noticing blood in his urine. The doctor performed a renal biopsy. Which CPT code represents this procedure? Option A, 50,200. Option B, 50,220. Option C, 50,225. Option D, 50,230. The correct answer is option A, 50,200. A, 50,200. Question 225. Ryan had been experiencing chronic chest pain. During a diagnostic procedure, the anesthesiologist administered anesthesia to keep him comfortable. Which CPT code represents anesthesia for intrathoracic procedures? Option A 00520, Option B 00522, Option C 00524, Option D 00526. The correct answer is Option C 00524. C 00524. Question 226. While hiking, Alex slipped on a rock and hurt his ankle. At the hospital, they discovered a hematoma that needed to be incised and drained. Which CPT code represents this procedure? Option A 20005, Option B 20055, Option C 20000, Option D 20025. The correct answer is Option A 20005. A 20005. Question 227. Bianca visited an oral surgeon due to a cyst under her tongue. The surgeon decided to perform a marsupialization of the ranula. Which CPT code is appropriate for this procedure? Option A 40800, Option B 41115, Option C 40801, Option D 40806. The correct answer is Option B 41115. B 41115. Question 228. Sarah uses a continuous positive airway pressure CPAP device for her sleep apnea. Which HCPCS Level II code pertains to the CPAP device? Option A E0601, Option B D0621, Option C D0631, Option D D0650. The correct answer is Option A E0601. A E0601. Question 229. During a hernia repair, Dr. Stevens administered anesthesia to ensure Michael was comfortable and pain-free. Which CPT code represents anesthesia for an inguinal hernia repair? Option A 00102, Option B 00144, Option C 00145, Option D 00148. The correct answer is Option B 00144. B 00144. Question 230. Sophie, pregnant with her first child, went for an ultrasound in her second trimester. Which CPT code is appropriate for a routine obstetric ultrasound of a fetus? Option A 76805, Option B 76810, Option C 76815, Option D 76816. The correct answer is Option A 76805. A 76805. Question 231. Sophie, after a minor car accident, had a nosebleed that wouldn't stop. The ER doctor performed a nasal endoscopy to control the posterior nosebleed. Which CPT code is appropriate for this procedure? Option A 30,000, Option B 31,255, Option C 31,231, Option D 30,903. The correct answer is Option D 30,903. D 30,903. Question 232. Ryan had been experiencing chronic chest pain. His cardiologist ordered a chest CT scan with contrast. Which CPT code represents a CT of the chest with contrast? Option A 71,250, Option B 71,260, Option C 71,270, Option D 71,275. The correct answer is Option B 71,260. B 71,260. Question 233. Nina, who had been dealing with depression, visited a psychiatrist who prescribed her a 30-minute psychotherapy session. Which CPT code is appropriate for individual psychotherapy for 30 minutes? Option A 90,832, Option B 90,834, Option C 90,837, Option D 90,839. The correct answer is Option A 90,832. A 90,832. Question 234. Tom was diagnosed with bilateral primary osteoarthritis of the knee. Which ICD-10-CM code is suitable for this diagnosis? Option A, M17.0. Option B, M17.1. Option C, M17.2. Option D, M17.3. The correct answer is option B, M17.1. B, M17.1. Question 235. Samantha was diagnosed with acute sinusitis due to Streptococcus pneumoniae. What ICD-10 code corresponds to her condition? Option A, J01.00. Option B, J01.10. Option C, J01.01. Option D, J01.11. The correct answer is option D, J01.11. D, J01.11. Question 236. Dr. Parker recommended a colonoscopy for Maria due to her family history of colorectal cancer. Which CPT code represents a diagnostic colonoscopy? Option A, 45,378. Option B, 45,379. Option C, 45,380. Option D, 45,381. The correct answer is option A, 45,378. A, 45,378. Question 237. Lena, a 28-year-old, was diagnosed with a mild form of endometriosis. Which ICD-10 code corresponds to her diagnosis? Option A, N80.0. Option B, N80.1. Option C, N80.2. Option D, N80.3. The correct answer is option A, N80.0. A, N80.0. Question 238. Leo visited a cardiologist due to chest pain. The doctor took an extended history, reviewed multiple systems, and performed a detailed examination. Which CPT code represents this level of service? Option A, 99,221. Option B, 99,222. Option C, 99,223. Option D, 99,220. The correct answer is option C, 99,223. C, 99,223. Question 239. Robert visited an ophthalmologist after experiencing blurry vision. After examination, the doctor diagnosed him with cataracts. Which CPT code corresponds to a cataract removal with intraocular lens insertion? Option A, 66,982. Option B, 66,984. Option C, 66,983. Option D, 66,985. The correct answer is option B, 66,984. B, 66,984. Question 240. The largest bone in the human body is the Option A, humerus. Option B, femur. Option C, tibia. Option D, fibula. The correct answer is option B, femur. B, femur. Question 241. Which organ is responsible for producing insulin? Option A, pancreas. Option B, liver. Option C, kidney. Option D, spleen. The correct answer is option A, pancreas. A, pancreas. Question 242. With symptoms of anemia, Riley's doctor ordered a complete blood count with differential. Which CPT code pertains to this test? Option A, 85,027. Option B, 85,025. Option C, 85,029. Option D, 85,023. The correct answer is option B, 85,025. B, 85,025. Question 243. Sophie, pregnant with her first child, went for an ultrasound in her second trimester. The anesthesiologist administered anesthesia to keep her comfortable during the procedure. Which CPT code represents anesthesia for a routine obstetric ultrasound? Option A, 00860. Option B, 00864. Option C, 00862. Option D, 00868. The correct answer is option A, 00860. A, 00860. Question 244. Which U.S. federal regulation protects the privacy and security of patients' medical information? Option A, Affordable Care Act, ACA. Option B. Clinical Laboratory Improvement Amendments, CLIA. Option C. Health Information Technology for Economic and Clinical Health, HITECH, Act. Option D. Health Insurance Portability and Accountability Act, HIPAA. The correct answer is option D. Health Insurance Portability and Accountability Act, HIPAA. D. Health Insurance Portability and Accountability Act, HIPAA. Question 245. After her morning run, Maria noticed a painful abscess on her thigh. She immediately went to the clinic, where the doctor performed an incision and drainage. Which CPT code represents the incision and drainage of an abscess? Option A, 10,080. Option B, 10,021. Option C, 10,060. Option D, 10,160. The correct answer is option A, 10,080. A, 10,080. Question 246. James had difficulty breathing and underwent a pulmonary function test to assess his lung function. Which CPT code represents a simple pulmonary function test? Option A, 94,010. Option B, 94,060. Option C, 94,070. Option D, 94,015. The correct answer is option A, 94,010. A, 94,010. Question 247. After a minor car accident, Emma was taken to the emergency room. They found a hematoma in her shoulder that needed incision and drainage. Which CPT code pertains to this procedure? Option A, 20,005. Option B, 20,010. Option C, 20,016. Option D, 20,100. The correct answer is option D, 20,100. D, 20,100. Question 248. For outpatient coding, when coding for a condition that is both acute and chronic and separate subentries exist in the alphabetic index, which code should be sequenced first? Option A, acute. Option B, chronic. Option C, either, based on the severity. Option D, the condition that is being treated during the visit. The correct answer is option A, acute. A, acute. Question 249. Alex was diagnosed with type 1 diabetes mellitus without complications. Which ICD-10-CM code represents this diagnosis? Option A, E10.9. Option B, D11.9. Option C, D13.9. Option D, D08.9. The correct answer is option A, E10.9. A, E10.9. Question 250. John, an avid gardener, discovered a wart on his finger. Concerned about its appearance, he consulted a physician who recommended its removal. Which CPT code covers the excision of a wart? Option A, 10,021. Option B, 10,040. Option C, 10,060. Option D, 10,120. The correct answer is option B, 10,040. B, 10,040. Question 251. According to CPT guidelines, if a code exists that describes a certain service or procedure, you should: Option A, use a similar code that might fit. Option B, use the exact code describing the service. Option C, use an unspecified code. Option D, use any code as long as it's from the correct section. The correct answer is option B, use the exact code describing the service. B, use the exact code describing the service. Question 252. Dr. Lewis found a nodule in Chloe's thyroid and decided to perform a core needle biopsy. Which CPT code covers this procedure? Option A, 60,100. Option B, 60,240. Option C, 60,271. Option D, 60,101. The correct answer is option D, 60,101. D, 60,101. Question 253. Grace required a knee replacement. The anesthesiologist administered anesthesia specific to the lower leg procedure. Which CPT code is suitable for anesthesia during a knee replacement? Option A, 01402. Option B, 01400. Option C, 01404. Option D, 01406. The correct answer is option B, 01400. B, 01400. Question 254. During a routine checkup, a physician noticed a suspicious lesion on Peter's back. To ensure it was benign, the doctor performed a punch biopsy. Which CPT code is appropriate for a punch biopsy of the skin? Option A, 10,040. Option B, 10,005. Option C, 11,104. Option D, 11,100. The correct answer is option C, 11,104. C, 11,104. Question 255. Elena visited the ER with a severe migraine without aura, not intractable. What ICD-10 CM code corresponds to her condition? Option A, G43.009. Option B, G43.109. Option C, G43.209. Option D, G43.309. The correct answer is option NaN,